Good morning, ladies and gentlemen. As the president of the Hong Kong Dental Association, I'm pleased to welcome you to the thematic webinar of the focus on COVID-19. The program consists of two parts. We are delighted to have invited Dr. Siddharth Sridhar to present the Facing a Tsunami, Hong Kong's fifth wave, while Dr. Haston Liu will elaborate on the setting up of air ventilation at dental clinic during COVID-19. Before proceeding with the presentation, I would like to give a brief account of the association's work in rendering support for our members in facing the rampant hit of COVID-19. In supporting members' dental service provision under the current situation, we have newly set up a thematic email account, COVID-19@hkda.org, for handling members' inquiry on COVID-19, which is in operation since last Wednesday on 23rd February. Upon receipt of members' inquiry, the Hong Kong Dental Association Council responds to the requesting member at our best. In our latest flyer to members, we have also opened a registration channel to members who are looking for volunteering opportunities. Members who are interested to join the government's force in safeguarding the health and safety of our community, they are most welcome to fill in the Google form to provide their contact detail for our putting forward to the government for their recruitment exercise whenever required. In the past few months, the association has been keeping in close communication with our members timely by issuing reference and updates in electronic means. We have issued reference material and list of medical supplies to address members' concern and need through our website, Facebook, Instagram, and email. Along with the pandemic development, numerous aspects have been covered by the collective effort of the Council, as shown in the PowerPoint. What's more, we have put surgical respirators for sale to our members to address the imminent need 2 weeks before. Besides, we also consolidate reference material for members' quick reference in tackling different scenarios in the event of COVID-19 case happen in our clinics. Please refer to the latest update on clinic management of staff and patients under COVID-19, which has been newly posted on our Facebook and website last Friday. Most likely, we will have an update today. To provide members an even greater convenience, we have compiled a list of suppliers to facilitate members to sourcing of COVID-19 and dental-related supplies during the challenging time. All such material information mentioned above are available on Hong Kong Dental Association's Facebook page and website under the thematic column of COVID-19. Members are highly recommended to visit the platform more frequently for our updates timely. The first lecture. May I first introduce our speaker of the first lecture, Dr. Siddharth Sridhar. Dr. Sridhar is a clinical assistant professor at the Department of Microbiology of the University of Hong Kong. He is a clinical virologist with a special interest in emerging infectious disease and the impact on vulnerable patient groups. He is actively involved in COVID-19 research and has published several studies on COVID-19 diagnostic assay development, several epidemiological study, animal model, clinical pathological research, and surgical mask efficacy. For the presentation today, Dr. Sridhar will give us update on the latest local COVID-19 situation. He will also update us on personal protection method and adjust current testing capacity in Hong Kong, the function of rapid antigen tests, RAT, and what to do if one or his family member tests positive. Furthermore, some basic guidance for COVID-19 infection control in healthcare facility will also be addressed. About the second lecture. For the second lecture, it will be presented by Dr. Haston Liu. Dr. Liu is our past president and chairman of task force of the PHFO of the Hong Kong Dental Association, as well as member of campaign committee under the PHFO. He has been the part-time lecturer of Faculty of Dentistry, University of Hong Kong, and examiner of Hong Kong licensing examination, MGDS, MRACDS, conjoint examination, and MGDS, RCS Edinburgh examination. The short-range air transmission, with its highly infectious nature, make up most of the COVID-19 cases in Hong Kong. Omicron caused a significant impact to dental practice. The upcoming lecture by Dr. Liu will focus on the setup of air ventilation system at the dental surgery to deal with COVID-19 and ways to address the environmental constraint. The design of airflow, air change per hour, follow time, use of mechanical air filter, exhaust air of high volume suction are topics that need to be addressed relating to air ventilation of dental surgery. May I now invite Dr. Sid to deliver his presentation. Dr. Sid, please.
Good morning. Thank you for inviting me to this webinar. So let me begin. So as I said, thank you very much for inviting me to present at this webinar. We are genuinely facing a tsunami, and I think I will, well, the message that I want to get across from this short presentation is that we are facing an unprecedented health crisis in Hong Kong that affects all of us. And thank you for the kind introduction. And as was pointed out, what I'm going to do is mostly in this lecture, I'm going to focus on the scope of the problem as well as what we can do to protect ourselves and our families, and what to do in case we get infected as well. So I hope that's useful. I understand that the second talk by Dr. Liu will be more on infection control in dental practice. So I won't focus on that too much, considering that he's definitely much more of an expert on this area than I am. So without further ado, let's begin. The reason we're all sitting here is because of this variant of SARS coronavirus 2 called Omicron. So Omicron essentially burst out into the scene in November 2021. And this was the initial experience in South Africa, which at the time was experiencing a very, very bad surge in Delta, which you can see in red here. So the surge of this variant called Delta. But then what happened in November is that they saw a very rapid escalation in cases due to a completely new variant, and that is basically called Omicron. Omicron has now formally been designated as a variant of concern, and it is now rapidly spreading globally. It is replacing Delta around the world, and we can see how powerful it is in Hong Kong. And the Omicron actually has two subvariants, BA1 and BA2. There are some differences between them, which I'll also talk about. But in Hong Kong, the majority of cases are due to the Omicron subvariant BA2. So if you hear the term BA2 in press conferences from the government or other media, you know that we're talking about the Omicron variant. Get my pointer up here. Now, the really most striking thing about Omicron is that it is extremely transmissible. Now, the reason it is transmissible is because it is airborne, but actually previous variants of SARS-CoV-2 were also airborne. The problem with Omicron is that it suddenly made everybody re-susceptible to infection, even if they were vaccinated twice, or even if they had a prior infection. Their prior infection or vaccination did not protect them from catching an Omicron infection. So in societies, communities around the world and in Hong Kong, we suddenly see a massive expansion in the susceptible population and an extremely transmissible variant that is essentially airborne. And because of those two reasons, we see these massive, very fast upsurge in cases that we really have seldom encountered with other variants, right? So this was a study from Europe, for example, looking at the secondary attack rate. First of all, the secondary attack rate means the number of people in a household testing positive after an index case appears in the household. And you can see that generally for Omicron, the secondary attack rates are very high. Even in the larger European homes, okay, the chance of a household member testing positive approaches 40% for the variant that's circulating in Hong Kong, BA2. Now, if you think about homes in Hong Kong, much smaller in size, very cramped, a lot of people living in a very small space, especially in public housing estates, I'm sure we're going to be talking about even higher secondary attack rates, right? So this shows the very high transmissibility of Omicron, and that's really being shown for both in both the European Union setting in this Danish study as well as the UK study, that essentially the secondary attack rate does appear to be significantly higher than not just the Delta variant, but also the previous version of Omicron, that's BA1. So this means that Omicron is much more transmissible. Now, the big debate is actually how severe is Omicron. I'm sure you've all seen media reports saying that Omicron is less severe than previous variants, and that actually is true. You look at the South African experience, in their current wave, the proportion that have died, okay, or the proportion that have severe disease is actually lower than in previous waves due to Beta or Delta. And this experience has been repeatedly shown for both the BA1 Omicron variant as well as the BA2 Omicron variant. They're not really that different in terms of severity. So the severity appears to be lower, but there are two reasons for this. The first reason is that in many parts of the world, including in South Africa, most of the population is either vaccinated previously or has been infected previously. So they have some degree of immune memory against COVID-19 in general. So that can actually bring down mortality rate or rates of severe disease quite a bit, because your immune system your T cell immune response kind of knows how to deal with Omicron, even though it is so divergent to other kinds of SARS coronavirus 2, right? So that's one reason. The other reason is potentially because Omicron itself is less virulent in terms of it perhaps doesn't infect the lung tissues quite as well as previous variants. Most of the infection is restricted to the airway, etc. The problem is we don't know how much of reduced virulence or severity is due to intrinsically reduced virus virulence versus high population immunity. And that is a problem for Hong Kong, because in Hong Kong, we have this massive unvaccinated population. Before the fifth wave, most individuals in Hong Kong had not caught COVID-19 before. So unfortunately, when you have such a transmissible variant, we are going to see a lot of severe disease in our elderly population. And already we have confirmed that death rates in Hong Kong per million population is much higher than other high-income regions that have higher rates of vaccination. So unfortunately, a lot of the death that we're seeing in Hong Kong today was potentially vaccine preventable, but it's what has happened, okay? In general, we estimate that Omicron by itself, the virus by itself, is about 25% less severe than Delta, okay? So it's less severe, but because it's more transmissible, you end up with more cases. So the number of severe cases in Hong Kong due to Omicron would be the same as if we had experienced a Delta outbreak. So that is the unfortunate fact of Omicron. Less severe, but more transmissible. So you end up with more cases with the same number of severe cases. The most important question I'm sure everybody is very concerned about is vaccination. We now know that if you have received 2 doses of the BioNTech vaccine, so it's essentially not going to protect you against catching Omicron infection. So like me, I received my second dose of the BioNTech vaccine about in April of 2021. By now, 25 plus weeks after dose 2, the vaccine effectiveness against catching the infection is basically 0. Okay, but when I get the booster, if a person gets a booster of BioNTech after the first 2 doses, the vaccine effectiveness essentially jumps, okay, to somewhere in the range of 60 to 80%. And there is some indication that this protection wanes over time because antibody levels that are most important for neutralizing the virus and preventing us from catching infection also drops over time. 15 plus weeks later, the protection still exists, still significant, but it's about 40%, okay? So this is data from the Health Security Agency of the United Kingdom. But we're not interested, 2 years into the pandemic, we no longer care about symptomatic infection. The majority of symptomatic infections is just sengfeng gammo, it's just a mild infection. It's not a severe infection. What we really care about when it comes to vaccination is protection against hospitalization and death. This is what we're really concerned about. Now, 2 doses of the vaccine, this is the protection against hospitalization or death due to the Omicron variant. 2 doses of the vaccine, more than 6 months after receiving the vaccine dose, you can see that it's still okay, 30 to 40% with a very wide confidence interval. So I should say it's maybe up to the late 40s, maybe as low as the early 20s. Okay, we don't have enough data for a more precise estimate, right? Because especially in the UK, they've really cut the link between case numbers and hospitalization and death. So they don't have a lot of these severe cases left. Once you get your 3rd dose, the protection against severe disease actually goes up fabulously. We're talking about 70% plus protection against severe disease. So what this means is compared to an unvaccinated individual, a triple vaccinated or boosted individual has approximately 70 to 80% less risk of hospitalization and death. And that's why I say that a lot of the calamity we are seeing in Hong Kong public hospitals in terms of severe disease or death is vaccine preventable. Okay. Now, this is for hospitalization in general. This is the data for death. And you can see with 3 doses of the vaccine, essentially you are protected from death. Okay, we're talking about 95% protection reduction in mortality compared to an unvaccinated individual. So that's very, very high indeed. Even with 2 doses, it's a significant reduction in mortality after from Omicron. Right. The big question is then, what about CoronaVac? Real world vaccine effectiveness of CoronaVac against Omicron, we don't know. Actually, Hong Kong is in a great position to come up with this data, and I hope we start seeing it very soon, but we don't have the actual percentage figures like we do for BioNTech. What we do know from this, this is actually a very good local study done by the University of Hong Kong. They look at antibody levels after different vaccine regimens. So 2 doses of BioNTech against Omicron, very low antibody levels. As I said before, doesn't protect you from infection. 2 doses of CoronaVac, Foheng, also very, very low levels of antibodies. It won't protect you from infection. 3 doses of BioNTech, you see the antibody levels against Omicron shoot up. And that's why you see that protection against symptomatic infection. 3 doses of CoronaVac, okay, I'm afraid the antibody levels don't do very well. Okay, they go up not by a lot, not as much as this jump, right? So that's why 3 doses of CoronaVac is not really expected to give you much protection against catching Omicron. It may give you some protection against severe disease because that involves a T-cell immune response, and that's a different thing altogether. It may protect you against severe disease, but against catching infection, you can expect it to be much less than 30 or 40% effective, okay? Now, here's the important part. If somebody has received 2 doses of CoronaVac and then they get a booster with BioNTech, so we are talking about mixing vaccines here, it actually goes up much higher. So compared to 2 doses to 3 doses of CoronaVac, 2 doses with the 3rd dose of BioNTech, you can see the antibody levels shoot up quite a bit. So this is why the official recommendation from the Joint Scientific Committee and the advisory panel on COVID-19 vaccination advises that you receive 2 doses of CoronaVac, make sure that the 3rd one is a BioNTech vaccine. Okay, so that provides optimal kind of humoral antibody and probably T cell responses against Omicron. So that's what we recommend. Okay, now let's talk about the local situation in terms of Hong Kong's fifth wave. Now, when I was, what I said before is all science-based. We have known this for about 2 months or so, efforts of scientists worldwide, and it's actually pretty straightforward, right? With the Hong Kong's local fifth wave, I must say that the situation is extremely dynamic. We're fighting a war basically, and the policy, I prepared this presentation over 2 or 3 days, and in that time, the policy changed multiple times. So I had to keep updating the PowerPoint file. But let me try to explain what's kind of going on in Hong Kong. Now, this is the data up to the 21st of February. So that was last week. We noticed something very funny in Hong Kong, right? The number of cases is approximately the same every day, right? So you would see that over this time, the number of cases, well, you have several days in which the number of cases is completely identical. Now, this is completely against our understanding of how COVID-19 waves actually happen, in which you typically see an exponential rise in cases. So why does this number seem so steady? The reason is because Hong Kong's testing capacity is overwhelmed, right? So we only have the capacity to confirm a certain number of cases per day. So that means that cases are locked at a certain level each day, even though there is an exponential rise of cases in the community. So what's happening in Hong Kong is every day we're only measuring the tip of the iceberg. There is a massive amount of the iceberg that is completely underwater, hidden from sight. Why is that the case? Testing capacity is exhausted. There's a massive testing backlog. We've all heard stories about cases that require 6 to 7 days for getting their PCR result back. By then, those results are useless, right? There is a massive backlog in contact tracing. It's been given up in several settings, such as restaurants. Lots and lots of asymptomatic infections. Some estimates suggest 20 to 30% of cases are asymptomatic. Those people are not going to test. Until recently, okay, this changed over the weekend, but rapid antigen tests were previously not recognized. So a lot of people who are being RAT positive are not officially documented as having COVID-19 testing. Let's be honest, testing positive in Hong Kong is not easy. It comes with a prolonged duration of isolation and quarantine of close contacts. And we probably, to be very honest, all of us here would know of people who have symptoms but who haven't gotten tested yet. And that means we're not measuring the amount of COVID in Hong Kong. Unfortunately, this is changing, but before the fifth wave, we don't have an alternative way of measuring how much COVID there is in the community. In the UK, they have something called an ONS survey that's independent of official testing figures to actually gauge how much COVID there is in Hong Kong. The Hong Kong You Met has started a project which is in the style of ONS survey, so we can actually see how bad the fifth wave actually got in Hong Kong, but the data will take some time to collect. So in Hong Kong, I won't say most likely, we definitely have much, much more than 10,000, probably actually a few 30 to 40,000 or above cases per day. There's no doubt about it. And the cases are doubling every 3 days. So we're still in the peak when it's still going up. So that's where we are. And actually, we confirmed that over the weekend, the government said RATs are fine, and suddenly a huge number of cases got dumped into the system. So on the 26th of February, the official case count was something like 45,000 cases. And after that, it dropped again to 10,000 something, but the real number is probably somewhere like 40 to 50,000 cases. And it's already like this, okay? So, I mean, we've seen some very, very disturbing pictures from A&E departments in Hong Kong, and as well as, I'm sure, the very disturbing images that were distributed yesterday and day before on the public mortuary situation. It's looking very bad. And remember, we have still not seen the peak yet. So it's still going to get worse, unfortunately. How bad is it going to get? So one thing that we can rely on is a modeling study. So this was done by Hong Kong You Met on February 10th, and it was then revised on February 17th. So a modeling study is when you try to predict what the future is going to look like depending on the present and what you know about the virus behavior. Limitations of modeling studies would be that they do tend to make several assumptions that may not hold up over time. But whatever it is, they're a reliable gauge on what the situation may look like in Hong Kong in the future. So based on this study, they published a number of graphs. So you look at the daily number of infections, the daily number of symptomatic cases, daily number of hospitalizations, and daily number of deaths. One thing I would comment on this is that the peak is probably going to be earlier than indicated in the graphs here. So it looks like we're going to peak in early March rather than mid-March. We are going to see hundreds of thousands of cases per day at the peak. So there's no doubt about it. And that is going to have a knock-on effect on hospitalizations as well as deaths. So they estimate that the peak number of deaths per day in the Hong Kong U study should hit about 136 in March. I think we're going to get there in early March, and it may be, unfortunately, it may be a bit higher because our healthcare system is going to be overwhelmed by that date. So my thinking is 150 to 200 deaths at the peak, and we're getting there. Unfortunately, we already had 100 odd deaths per day as of yesterday. So it's going to get somewhat worse, okay, before it goes down. Now, the numbers are really mind-boggling. The cumulative number of infections they expect, according to this modeling study, by May in Hong Kong is approximately 5 million, okay? So it's a very, very grim picture. So this is a situation under the current kind of pandemic measures that we see that unfortunately are not going to stop transmission substantially. So we're going to see sustained transmission. This is basically a fifth wave like we saw in Italy or Spain in 2020, Iran in 2020, if you guys remember the very uncertain days back then, India in 2021. This is what it looked like back there, okay? But now it's Hong Kong's turn. I wish we were better positioned in terms of our vaccination rate, but it is what it is. So what does March look like in Hong Kong? Devastating outbreaks in elderly homes, it's already happening. Occasional deaths in children and younger adults, already happening. Overwhelm inpatient and intensive care, the worst is yet to come. There will be a manpower crunch because many staff are on sick leave due to requirements for isolation and quarantine. I personally know at least, 5 medical staff who are on isolation/quarantine and can't come back to work. Community isolation facilities are overwhelmed, contact tracing capacities are overwhelmed, and I think something that we have to bear in mind is elective procedures are going to be postponed, and this is going to lead to a post-wave surge in workload. And this is why this is an absolutely unprecedented healthcare crisis in Hong Kong's history. One of the main reasons why things are so bad is because so many of Hong Kong's elderly are unvaccinated. So this is the data from last week. Looking at the unvaccinated segment of the population, and you can see that there is this massive 500,000 elderly population, 60 and above, who basically have decided not to go and get jabbed. Okay, this is changing because COVID-19 is now in Hong Kong. We see some queues forming at vaccination centers, etc. But really, it's regrettable that this did not happen in 2021 because that would have put us in a much better position than we are currently. In the other segments of the population, it's a little bit better, but you still see substantial portions that are unvaccinated. And luckily, I think for the younger age groups, generally, they're going to get through fine, especially because Omicron does seem inherently less virulent. But for the 80 and above, the case fatality rates published by CHP yesterday was about 4%. So it's not easy. It's very, very nasty indeed. Good. So this actually is already a little bit updated. There's been an updated analysis yesterday night that unfortunately I couldn't upload the PowerPoint in time. The first 102 deaths in the fifth wave, only 7 had received 2 vaccine doses. All others were either unvaccinated or only received 1 dose. I keep saying COVID-19 mortality is potentially, actually almost likely vaccine preventable. please remind patients to receive their vaccines. I'd be really very grateful if you could push for that, if you could be advocates for that, and best 3 shots in the elderly. The updated analysis that I was talking about looked at many, I think it was 500 odd deaths in total during the 5th wave, and about 91% of them were actually unvaccinated. Okay, so it's this is actually the experience throughout the world. We've known this for the last 1.5 years with, well, 1 year and 5 months once the vaccination campaign started. The main role of vaccines is in preventing severe disease and mortality. So we have known this all along, and it is sad that we have to seek reconfirmation in Hong Kong. But it is what it is. Okay, now let's talk about how to protect ourselves. I'm a big fan of respirators. So there was this recent study from the US CDC that did find a trend towards lower rates of COVID-19 among people who habitually wore respirators like N95 and KN95. I don't want to mislead. I will point out that the differences were not statistically significant, but there was a clear trend that compared to not wearing a mask, respirators were associated with more protection than either cloth masks or single surgical masks. So the type of mask does matter, especially if, I mean, in dental clinics, I'm sure most of you would be wearing respirators because these are essentially aerosol generating procedures. When you're wearing respirators, please bear in mind that the seal is very important. So make sure there's no air leak around your mask as much as possible. When you're performing aerosol generating procedures, it is important to also pay attention to gown, gloves, and eye protection. I think this is pretty obvious stuff, so I won't spend too much time on this. I won't spend too much time on this either. This is just some of the infection control guidelines from the CDC for specific to dental clinics. So this is something that I think will be covered in the second lecture, so I don't want to overlap much. But they do talk about various mitigation methods and settings where you're performing aerosol generating procedures, and those are listed here, okay? And there are other possible measures. I paying due attention to ventilation in clinics, air purifiers with HEPA filters, and very important because there are so high community rates, health surveillance for staff, daily rapid antigen tests for staff, or even rapid antigen tests for patients prior to procedures may all help to reduce risk during this difficult time. But again, I really don't want to focus too much on that if there is another lecture scheduled on the same topic. So let's talk about what to do if there is, if you're self-tested positive, for example. This is changing like twice a week, so it's very difficult to stay up to date. Now, as of last week, actually, I think this is still the scenario in that if you do a self-arranged rapid antigen test and that undergoes positive, then as per the government website, you still have to undergo further nucleic acid testing for confirmation. Although officially they have said that they're now going to accept RATs, they're still working out the system for reporting the RAT results and the next steps, etc. So there's still some uncertainty there. So I think in Hong Kong, we have put together an infographic that is a little bit more user-friendly. So the first step is to confirm your test result, your RAT test result with a nucleic acid test for confirmation. The government website actually lists how you obtain the deep throat saliva specimen bottle and how to submit it. I think some services like GoGoVan actually will help to take it away from your home once you've collected the sample. And once you do that, how do you protect your family? The typical scenario that I see repeatedly in the last week is that one family member tests positive. Now, if you have a slightly larger house, it helps. You actually make the infected person stay by themselves in one room of the house, okay? And open all the windows in the house. Everybody in the household should wear a mask as much as possible, except when they're eating. The infected person and other uninfected household members should not eat together. Toilets when an infected person uses a toilet, make sure the windows, if available in the toilet, are completely open. If the infected person uses a toilet, then make sure that they some degree of basic disinfection of the toilet with a diluted household bleach or whatever after using it. Wait for about 20 minutes or so for the air change to happen in the toilet before an uninfected member uses it. Okay. And I think it's really, really important that windows are open. Ventilation is just so important. And it's also good, I think, once we get RATs more readily from the government, or I'm sure many of you have self-purchased RATs at home, that household members who are not infected keep doing it on a regular basis. Okay, and in terms of seeking medical attention, remember I've told you what I've said, that Omicron in most cases are going to be mild. So it's most important to remain calm. Do not go to the A&E unless the health situation is really, really bad. Okay, so if you have a pulse oximeter at home, especially if you have, I don't recommend this for younger people, but for older people, monitoring their SpO2 is actually probably a good idea. So that's important. And of course, seek medical attention if there are signs of severe symptoms. This is a brief list, but I'll go over it in more detail later. So in slightly more detail here, if you have a positive nucleic acid test result, then in terms of the logistics, right? Now, this is a bit difficult because what's happening in practice is the home isolation that I've been talking about in the previous slide. The official stance is still that people who are infected should go to a community isolation facility. Problem is the community isolation facilities are completely full. So once you actually report that you're infected via this QR code or website, okay, it enables you to enter your information. The reality is that you're put in a waiting list for community isolation facilities, and you just wait at home. For most people, by the time they finish their isolation period, the community isolation facility still is not available. So you're going to isolate at home for most people. Okay. And essentially, what happens is it depends on whether you have symptoms or not, depends on your risk status, etc. But generally speaking, if you're experiencing more severe symptoms, there is a hotline that you can call. And there are two things that can happen. Either you are referred to an A&E facility, or you're actually referred to a designated clinic that sees COVID-19 patients with milder symptoms, right? But so there are avenues via this hotline for seeking medical attention while you are at home. Now, they have identified certain risk groups that would require closer attention. So if you're an older person, pregnant women, younger children, immunocompromised patients, their position in the waiting list would be automatically updated. So they would be in a better position to either get isolated in a hospital or a community isolation facility. So again, this is from the Hong Kong UMed side, basically complementing this guidance from the CHP side. So with no or mild, so if you have higher risk, early conveyance to hospital, yeah, if possible, if they have the space. But if you have no or mild symptoms, transfer to community isolation facilities as far as feasible. It's basically usually not feasible. You'd have to continue isolating at home. And as I said, there are designated clinics and other services available in this hotline. So if there's something beyond a simple upper respiratory tract infection happening during isolation, there is a number that you can call. Now, all of this is changing. RATs would now be accepted as formal proof of diagnosis. We're still pending some actual details on the implementation side. I think what I've heard is the website is close to up and running already for reporting your RAT results. And so hopefully you won't need to do a PCR after your initial RAT is positive, okay? So that's going to reduce your strain on these community testing facilities and also improve the rate at which we pick up cases in Hong Kong considerably. This is the latest developments, I think, within the last 2 days, in that the duration of isolation has been shortened. Now, previously, it used to be 14 days. If you look at this guidance, 14 days. 14 days. Okay, so they used to require isolation for 14 days. Now it's much more reasonable. You save your sample on day 0, starting from day 1, the day after you save your sample, you perform RAT testing on day 6 and day 7. If you perform RAT testing on day 6 and day 7, if it is negative and you're feeling well enough in yourself, the fever is completely down, then that's it, your isolation is over. Same goes for close contacts. If your family member is a COVID case and you're a close contact, then it's the same rule applies. Close contacts may conduct RATs on day 6 and day 7 of the home quarantine period. If they obtain negative test results on these 2 successive days, that's it, it's finished. You can resume your daily activities. Your isolation/quarantine is over. Unfortunately, if you're still positive on day 6 and day 7, actually quite a few people will still be positive on day 6 and day 7. I don't know what happens after that. The guidance was not entirely clear. It's possible that they have to undergo further isolation and quarantine. Okay, so it depends on what happens. So that's also going to reduce pressure on people who have tested positive. So we want to encourage testing. So as I said, most people are going to be isolating at home. They're going to be in a waiting list for a community isolation facility or hospital admission or whatever. But if there are emergency warning signs for urgent medical attention, then things change. Okay, you have to go to hospital as soon as possible, and there is a hotline for doing that, as I've shown in the previous slide. And these are some of the more sinister symptoms, which I'm sure all of us would be very qualified to recognize as something very abnormal. Very large temperature fluctuations, seizures, neurological symptoms. For pregnant women, decreased or no movement of the fetus and persistent inability to drink or eat, diarrhea, vomiting, all of these signs of severe COVID should be alerting or emergency warning signs for urgent medical attention. And this is from the HA guidance on the home triage for deciding which cases to refer to hospital care. So it's a difficult time. I don't want to actually talk too much. I think I've already talked quite a bit. I want to set aside as much time as possible for a Q&A so we can discuss any questions that the audience might have at this time. In summary, stay home and stay safe, stay rational and compassionate. It's the best way to get through these emergencies. And peaks always come and go. Okay, so there is the peak is eventually going to recede. In fact, it may recede quite quickly by the end of March or April. And if the government comes down very, very hard at that time, well, we might go back to Dung Tai Chengling, which is definitely what they would want to do from all indications. Okay, so if you have any questions, please let me know. Thank you very much.
Hi, Sid. Yeah, I'm Dr Haston Liu. Yeah, I have got a question. Yeah, can you all hear me about what I'm talking about? Yes. Yeah. You got a Facebook post. It is about the use of RAT as a screening method. What is it? How is your opinion that for the dental clinic to use this kind of RAT for our patient screening? Yeah. Do you think that it should be a routine process for every patient, or it should be done in a kind of a risk-based process? Yeah.
So this is what an RAT, as I said in the post, is good for detecting infectiousness. In that it's better for detecting people who are actually infectious to other people. Okay. Having said that, RATs in general are much less sensitive than PCR for diagnosing COVID. They would miss about 30 to 40% of cases, right? So in a dental clinic setting, the difference is that many a time you'd be performing aerosol generating procedures. So if they're RAT negative but PCR positive, there's still a considerable infection risk because these are aerosol generating procedures. So having said that, what I'm going to say is that if you test a patient and they're RAT positive, you're definitely going to defer their dental procedure, okay? Or unless it is super urgent or life-saving. It's very important to postpone it because they're definitely infectious. If they're RAT negative, don't take it as complete reassurance that they don't have COVID or that they're not infectious in an aerosol generating procedure setting. If I was running a dental clinic, which I'm not, I would definitely administer RATs. Definitely, especially when the wave is still going up and when there are so many cases in the community. I think universal RAT testing for patients is definitely one way to try to lower the risk. But remember, all the other precautions are important as well, because RAT negative individuals can still be infectious when you're doing aerosol generating procedures. Having said that, they're good tools to at least filter out the most infectious people from posing a hazard to your staff.
Hi, Sid. We can actually notice that just there's questions from the floor. Yeah, and as a lot of concern is that although the government has changed the guidelines now that 7 days of isolation will be okay, then in your opinion, you think that after 7 days the RAT is negative, and then will it be a safe time for the staff to come back to work, or maybe that you want a little bit longer for more safe for the clinic? Yeah.
The hospital authority has been debating exactly this point, because we're running out of manpower when to get these COVID staff back to work, right? So I think our position on this is that my position on this is that if they have 2 consecutive negative RATs at 1 week post-symptom onset, their fever is completely down, their symptoms are getting better, they feel they can come back to work, then it is actually probably safe. Because when they actually go out, it's actually very safe, because when they go to work, I imagine many of you are using respirators. So they're going to be wearing respirators on top of that. So they're RAT negative twice, 24 hours apart, their symptoms are improving, and they're wearing a respirator in the workplace. It's actually, I think it's actually very, very low risk indeed, and it would disrupt your services as less as possible, right? What you can say is that if you're worried about that additional risk, don't eat in the clinic area or in the pantry, okay? So if they can get takeaway or dine elsewhere, then that would further limit the risk of infection. But actually the risk of infection with 2 negative RATs 24 hours past is pretty low. Remember that most people with, now the government advice said day 6 and day 7, but we do know from the research on this topic that most people would take longer even to clear the RATs. So many people may take up to 9 or 10 days post-symptom onset to clear the RATs. After day 10, the risk of shedding infectious virus for a person with normal immune system is really very low indeed. So 2 RAT negatives twice apart, asymptomatic, that's fine. But beyond day 10, that's another key time, okay? Beyond day 10, their risk of being infectious to others, especially when they're wearing a respirator, is going to be very low indeed. So, I mean, we've got to be rational about this, especially when we expect a lot of our staff to be infected, then this is a reasonable time point at which to bring them back to work.
Thank you, Sid. Yeah. Another question is that because in Hong Kong's dental clinic situation, we always have quite a limited space, and then the ventilation is quite limited. Yeah, and the use of a HEPA filter has been quite common nowadays that in most dental clinic. But however, there's always rumor about that the HEPA filters got some sort of medical grade or just HEPA filters. Yeah, but when I just do the literature review, they said that if that filter is set as a HEPA, it is already good enough to have got the virus or the virus carrying droplets filtered. Do you agree to this kind of statement, or do you think that a medical grade HEPA filter is necessary for the dental clinic?
As long as it says HEPA, it's fine. It fulfills the function that you want. So yeah, I actually don't know the difference between a medical grade HEPA filter and a normal HEPA filter, but a HEPA filter, as long as it says HEPA, it's going a long way towards cleaning up the air in the room, okay, from potentially virus-containing aerosols.
Yeah, and other question is that from the audience is that do you think that there's a possibility of the 4th fourth dose of vaccination is necessary. Yeah.
We already recommend a fourth dose as of last week to people who are immunocompromised. So this population in particular, guidance around the world has shifted towards a fourth dose. Now, for the general population, I do not think a fourth dose is the way to go for a younger population. Okay. And I think there is a possibility that the older population may benefit from a fourth dose down the line. But I really think we should wait on the science for this as to how much a fourth dose actually improves things, especially for the inactivated virus vaccines, where the science on this is a little bit more fuzzy. We've got to see whether increasing the number of doses to a fourth dose actually has an incremental benefit. So we should wait for the science before introducing this for the general population. But for the immunocompromised population, it's already the case that a fourth dose is required.
Yeah, fancy. Another question is that about that the elderly that who get the vaccinations but still suffering that mortality afterwards. Yeah. Just doctor would like to know, is it the vaccination really make the difference? That means the BioNTech and the Sinovac, yeah, for those steps case, yeah.
Yeah, we all want that data, but it was not disclosed which vaccine the double-dosed people received. So
thank you.
Double vaccinated people received. So we don't know yet.
Okay, thank you. Yeah. Okay. Just would like to know, there's any more questions from the floor? Yeah. If you've got further questions, that you are welcome to submit the questions, and then we will try to get an answers that after the presentation today. Yeah. Thank you, Sid, very much for your presentation. I think that we will keep regularly looking for your advice or your sharing of your insight. And in your Facebook's post, and I will also put in our Dental Association's Facebook, so that our DA members can have a chance to see what is inside your sharing about the RAT, and then is whether how can it be useful that in the dental practice. Yeah. Thanks a lot. Yeah.
Thank you very much.
Thank you.
Bye-bye.
Bye.
Thank you, Dr. Si. Now may I invite Dr. Haston Liu to continue the second lecture. Haston, please.
Yes. Thank you, everybody. Yeah. And I will switch to a Cantonese channel afterwards, because the coming presentation will be based on a video clip that I recorded last week. Yeah. And I will just let you have a look at that video clip first, and then afterwards that I will elaborate more on the view of me, and also that from other experts. Yeah. Okay. Accordio, please play the video recording. Yeah.
各位朋友，大家好。咁咧，我係廖偉良醫生。咁就由農曆年到而家，其實只係短幾個禮拜時間。咁但係大家見到 Omicron 嘅 case 咧，就已經係增加咗好多。由之前咧，只係咧每日咧就係幾十個，咁到而家差唔多咧就已經係接近咧就1萬個。咁喺即係社會上邊啦，咁已經有好多人咧就係即係確診啦，或者嚟講咧係初步確診嘅。咁所以我諗我哋都要喺呢方面嘅方面咧，就要多啲嘅即係留意啦咁樣嚇。咁就Omicron 嘅特性嚟講咧，佢係屬於一個咧就係短距離嘅空氣傳播。咁如果喺診所嚟講嘅話咧，短距離空氣傳播咧，咁其實嚟講咧同空氣傳播咧就冇乜分別嘅。咁所以我今日嚟講咧就會係着意咧就講一講就診所裏邊嘅ventilation 嘅 design， 咁同埋嚟講咧佢嗰個處理方案咧可以點樣令到咧我哋咧就減低咧Omicron 喺我哋牙科診所傳播嘅風險。咁我會分兩個部分嘅。咁第一個部分咧就好簡單講一講咧，就 reception area 嗰度我哋有啲咩可以做。咁第二個部分咧，我會嘥多少少時間咧，就講一講喺個 circle 裏邊嗰度咧，我哋有啲咩地方就要留意嘅。喺 reception area 咧，嗰個處理就會比較簡單一啲嘅。咁我哋主要咧係用一部咧嗰個換氣量夠高嘅空氣淨化機咧，咁其實就已經係達到嗰個效果啦。咁好似而家即係用緊呢一部咧係一部 medical grade 嘅空氣淨化機啦，咁樣。咁對於呢個房間嘅大細咧，咁就其實就已經係即係足夠 至於咧喺房嘅另一邊嚟講咧，我哋就有另一部嘅細嘅空氣淨化機啦，咁佢都係有啲消毒功能嘅啦樣啦。咁我諗其實呢部機咧，佢最主要作用咧就俾個病人一個大啲嘅信心。咁等個病人咧就知道咧，個醫生嚟講其實係對呢樣嘢咧係着緊嘅。咁而其實最緊要咧就係話咧喺我哋嗰個即係房間裏邊咧，就先至係即係做surgery 個房間裏邊咧先至係最重要，因為喺嗰個 moment 咧，病人係真係要除咗個口罩，係不停咁樣對佢呼吸。咁所以咧，我哋喺裏邊嚟講咧個功夫咧就會比較多一啲啦。咁就我諗而家大家咧，即係對嗰個 Omicron 嗰個傳播速度咧，就都係非常之即係詫異同震驚嘅，因為咧佢喺香港咁窄嘅環境之下咧，其實只係短短一個禮拜多啲嘅時間咧，咁我諗嗰個確診人數咧就以幾何級數咧咁樣上升。咁我諗大家對 Omicron 嘅特性咧都好清楚，咁就唔係淨係一個aerosol 嘅 transmission 啦，咁佢哋講所謂一個叫 short range 嘅air transmission。咁所以我哋如果譬如應對呢個咁嘅情況咧，咁其實就要係用一個airborne 嘅transmission 嘅 precaution 咧，就我哋咧去處理佢。咁關於個 airborne transmission precaution 嚟講咧，咁喺 CDC 裏邊嘅 guidelines 裏邊咧，佢就提到咧，即係有幾個重點嘅。咁第一個重點嚟講咧，就係當然咧就大家好清楚咧，就係用呢個surgical 嘅 respirator 啦，即係 N95 or equivalent， 甚至係再級數高啲嘅即係呼吸器啦咁樣嚇。咁另外嚟講咧，就係 hand hygiene 咧，就係入房出房之前嚟講咧，就都要咧就即係手衞生要做得好啦嚇。咁第三樣嘢嚟講咧，就係嗰個咁嘅即係啲嗰間房係嚟講咧，就要係即係閂好啲門啦，咁就唔好佢有機會嚟講咧喺你即係做嘢做 procedure 嗰個過程咧，有機會咧就係嗰啲即係 contaminate 咗個 air 咧就走咗出去。咁而另外一樣嘢咧，即係佢哋特別喺嗰個 infection control guidelines 度咧提到咧，就係關於咧。就嗰間房個 air ventilation 咧個設置啦。咁呢個air ventilation 嘅設置嚟講咧，喺以前嚟講咧，就一路大家咧都唔係話好特別咧，就睇得好緊咁樣嘅，因為大家都唔係覺得呢一個好大嘅問題。咁除咗係流感高峰期之外咧 ，otherwise 咧大部分嘅時間咧，我哋都係跟翻 standard precaution 我哋做嘢嘅啫。咁但係 Omicron 個威脅實在好大，咁所以我今日咧就會用啲時間咧去同大家咧解釋咧。究竟喺診所裏邊嘅 air ventilation 咧，我哋有啲咩地方咧就可以做得好啲？咁就air ventilation 咧有幾個部分嘅。咁第一個部分嚟講咧就係嗰個 unidirectional airflow， 即係話呢個空氣嗰個單向流向。咁第二個咧就係嗰個 ACH 嗰個換氣量嚇，咁同嗰個 Farrell time 係有即係直接嘅關係嘅。咁第三樣嘢嚟講咧，我亦都想講一講咧，就係話我哋嗰個 high volume suction 咧，我哋有啲咩地方咧？就要留意嘅。咁首先嚟講咧，就先講一嗰個unidirectional airflow。如果係一啲手術室嘅房間嚇，咁或者嗰啲負壓房咧，咁最理想嗰個空氣嘅流向嘅設計嚟講咧，就係啲空氣喺個天花嗰度落嚟，然後咧就喺個地下嗰度嚟講咧就排走。咁呢個咧就係一個最理想嘅做法。咁但係我諗而家大家都好清楚啦，即係診所就已經 set up 係咁樣啦。你要做咁嘅改動咧，除非係搬新嘅診所，或者你佢有機會去一個 medical 房。otherwise 嘅話咧，其實呢個嘢咧係做唔到嘅。咁所以咧，我哋咧就唔好糾纏，因為第時搬我先搞咧。即係我係喺而家呢個環境之下，我哋有啲乜嘢可以咧係即係做得咧就好啲咁樣嘅。咁好就先講嚟講咧，最基本一個airflow 嘅 design 樣嚇。咁好似喺而家我個診所裏邊嗰度咧，咁大家好清楚啦。咁呢個就係嗰個打燈嗰個位置啦。咁就係我哋平時咧就喺度做嘢嘅。咁喺我診所裏邊咧就有兩個嘅即係出風口。咁呢個第一個出風口啦。咁呢個就第二個出風口啊。咁咧呢個咧就係一個我哋叫做回風，即係回風嘅地方，即係話咧就係即係空氣咧就會喺度走翻入去裏邊嘅。咁照而家呢一個咧即係嘅circulation 咧就係話空氣咧就喺呢度嚟講咧就吹落嚟啦。咁經過個病人嘅頭啦，咁一路去個身體啦，去到腳啦，咁然後咧就上翻去上高嗰度咁樣嘅。咁呢個就係喺未有 Omicron 嗰陣時咧，即係呢間診所喺個空氣嗰個流向嘅設計嗰陣時咧個考慮嘅啫嚇。咁但係當然啦，即係 COVID-19 之後咧，咁我哋即係好多嘢都要考慮。咁所以除咗係即係保持住呢個流向之外咧，咁我哋其實就要加強呢個咧空氣流向嘅處理。咁確保咧，當我哋 哋即係做 patient 嗰陣時，patient 所噴出嚟嘅空氣啦，除咗係有機會咧係俾我哋嘅 high volume suction 咧移除之外咧，咁如果譬如有啲其他 escape 咗出嚟嘅部分嚟講咧，都可以咧，即係利用我哋呢個咁嘅即係 airflow 嚟講咧，就帶嚟我哋嘅身上邊，即係離開我哋嘅姑娘啦，離開我哋嘅身體上邊咧，就去一個遠啲嘅地方咁樣嚇。咁所以咧，你見喺我呢個診所個尾嗰度咧，你就會見到有一部咧高身嘅即係空氣淨化機。咁佢個作用嚟講咧，就係話咧，佢個吸風口咧就喺地下嗰度嚟嘅。咁而佢嗰個排風口咧就喺嗰個大概嚟講咧就喺個高度嚟嘅。咁就變咗嚟講咧，就係話我可以咧盡量令到咧嗰啲空氣嚟講咧係喺個病人個口去佢身上邊到佢腳。差唔多落到地下，再翻上高嗰度，咁而喺上高嗰度咧，就再駁翻上面呢個咁嘅風口啊。咁呢個就係我而家診所即係強化咗呢個所謂叫做air diffusion flow其中一個方法。咁另外你會喺側邊嗰度見到咧，就呢度咧，呢部只一部抽濕機嚟嘅啫嚇。咁呢度咧，亦都係另一部嘅抽濕機。咁呢兩部抽濕機咧，其實會將佢個風咧就一路咧就吹向咧就我嘅身上邊，咁就同埋我姑娘身上邊，咁咧就又係啦，就形成咗一個即係好似一個牆咁樣咧，就將嗰啲空氣咧就向前邊嗰度咧就好似佢咁樣嘅。咁呢個方法嚟講咧，我哋就覺得咧可以咧有效咧就幫助到咧就係咧嗰個空氣嚟講咧就係單向咁樣咧就去前邊個位置，即係話個病人個腳個位置嗰度就遠離我哋嘅身體。咁我做一個少少嘅實驗俾大家睇啦咁樣啦，咁咧就。而家大家見到台面上邊咧，就有一個所謂叫做啲類似係度嗰個空氣微粒嘅 meter 咁樣嘅。咁呢個就多謝曾醫生咧，就即係借出嚟啦 Century 借出嚟啦咁樣嚇。咁而家你見到個 baseline 咧，大概係8度。咁呢個咧就係COVID 啦。咁我大家日日都用嘅啦咁樣嚇。咁我就咁樣喺個情況之下咧，我會用 high volume suction。咁我就將嗰個噴咗出嚟嗰度啦嚇。咁咧就大家可以見到咧，而家嗰個讀數嗰度咧，其實嚟講咧就會慢慢一路咧就升緊嘅啊。咁當然啦，平時係唔會有呢啲咁嘅情況出現嘅，因為大家個 high volume suction 咧，咁其實咧已經係咧即係好辛勤地工作咧，就會將呢個咁嘅呢啲咁嘅所謂鋪片咧就完全咧係佢唔走嘅咁樣啊。咁我哋大概可能即係再噴多一陣啦。咁大家而家見到咧，佢嗰個讀數嗰度咧，其實咧係一路咧就慢慢咧就升緊上去嘅。咁可以大家睇一睇啦。咁一陣我哋到時到後嗰陣咧，又可以俾大家睇一睇。嗱，一開始噴嗰陣時咧，佢上緊，咁但係咧，佢其實嚟講咧，佢一路咧仲係上升緊咁樣嘅。咁我哋一陣咧就再講呢個部分啊。我其實跟住想帶出嗰樣嘢咧。第二樣嘢咧就係嗰個叫做 ACH Air Change per Hours。咁如果你留心衞生防護中心咧嗰個指引咧，咁佢就 mention 講過咧，就係話咧我哋譬如好似牙科呢啲係即係譬如佢所做嘅 aerosol generation procedure 咧，咁嗰間房咧個 ACH 咧，如果 keep 到係6嘅話咧就 OK 啦。嗱，6係嗰個 minimum 嗰個 requirement。咁但係如果而家我哋係真係 deal with 呢個Omicron 嘅話咧，咁究竟嚟講咧就係6，大家覺得係咪 OK 咧？咁我點解會咁樣問咧？咁大家其實如果睇翻咧就係呢個CDC ACH 即係嗰個 Air Change Rate 嘅話咧，咁你會留意到嗰個 fail time 咧，其實佢有一個比例嘅表格喺度嘅。咁咧如果係得6嘅話咧，其實嗰間房咧需要差唔多咧45分鐘到1個鐘頭咧，就先至可以將佢裏邊咧嗰啲懸浮粒子咧係清除嘅或者係移走咗嘅。咁所以咧，如果呢個亦都係一個問題咧，就係話當時咧就喺早2年前啦，英國 NHS 嗰啲牙科診所出現個問題啦。咁當時 NHS 個規定嚟講咧，就係佢哋個 fail time 咧係好似差唔多要去到1個鐘頭咧，就先至可以睇另一個 patient。咁即係話，如果你個 procedure 係做半個鐘頭嘅話，咁咧就嗰個換氣嘅時間嚟講咧係6嘅 ACH。咁你個 fail time 咧要1個鐘頭，即係又要等多1個鐘頭。咁即係話一晝咧就睇2個 patient，上晝2個，下晝2個。咁其 其實大家都知道咧，唔係好可行嘅，即係尤其是如果係 NHS 咧，佢哋嘅收費一般係比較咧，即係平嘅話咧，咁基本上咧就即係英國嗰邊嗰啲咁嘅牙科醫生咧係唔能夠 support 到咧佢哋嗰個診所嘅開支咁嘅。咁所以經過即係好耐嘅討論啦，咁佢最後嚟講咧就 accept 咗話咧，如果個診所裏邊有一啲mechanical 嘅purifier 或者一啲 mechanical 嘅 air filter 嘅話咧，咁咧佢哋就可以將個 ACH 咧個時間嚟講咧就會降低啊。咁好似以呢間房為例啦，咁呢間房咧嗰個平均嗰個呢間房嗰個面積嚟講咧，就大概係個體積大概係咧就係1200個立方尺啊。咁而我而家用緊嗰部咁嘅即係air purifier 咧，佢嗰個airflow 個量咧，大概嚟講咧係22000度啦。咁即係話咧，呢間房純粹係一個air mechanical filter 咧，佢個 air change rate 咧大概係差唔多去到18到20度咁樣嚇。咁即係話咧，若我嚟講咧，係15至20分鐘度咧就可以將嗰啲咁嘅房間裏邊咧嗰啲嘅懸浮粒子咧就排走㗎啦咁樣嚇。咁如果譬如我哋再加埋咧，我哋嘅 high volume suction 啦，或者如果大家想見到而家呢度咧呢部咁嘅 extra on suction 啦，咁好多醫生其實都問過究竟呢部嘢有冇用嘅咧咁樣嚇。咁我可以話俾大家知啦，即係早2年前咧，可能即係未必真係幫到大家，但係而家咧，我諗就唔好理咁多啦。即係如果你真係診所有嘅話咧，你就開埋用。係嘈啲，咁不過嚟講咧，就起碼嚟講咧，我諗即係對你自己啦，對姑娘咧都多一個保障啦咁樣嚇。咁呢部機咧開嗰陣時咧，就好似你搭飛機咁樣嘅，即係嘈到你講嘢聽唔到嘅。咁所以如果佢真係講嘢嗰陣時咧，就熄咗佢，再做嘢嗰陣時就開翻啦嚇。咁之前有啲 study 都睇過，即係話咧你如果其實用咗個所謂叫做嗰個叫做high volume suction 嘅，咁其實就已經 OK。咁但係嚟講，如果佢多少少保障咧，我諗會係一個太大嘅問題咯嚇。咁而跟住咧，我想另外有一樣嘢咧，就講一講咧，就係嗰個 high volume suction。個 high volume suction 嚟講咧，就之前嚟講咧，我哋香港咧就梁燕欣醫生咧，咁佢哋個團隊喺香港大學嗰度咧，就都做過一個即係 report，咁係證明呢個 high volume suction 咧係非常之有效咧，去 remove 啲aerosol 同埋一啲就 air particles 嘅。咁但係喺香港嗰個咁嘅即係診所嘅環境設計裏邊咧，我哋面對一個好大嘅限制，就係如果你個診所係喺地鋪嘅，咁我哋咧就可以即係有機會咧就將嗰啲空氣咧就即係排出街外邊啦咁樣嚇。但係如果我哋係商業樓宇除非你係一個 medical floor 有一個特定嘅就 air exhaust 嘅地方，如果唔係嘅話咧，好大機會咧你嘅師傅會將你個 air vents 咧即係嗰個排氣口咧裝喺個天花上嗰度嘅啫。咁即係話意味住一樣嘢就係話，如果譬如你真係有個病人，佢係確診COVID-19 嘅Omicron或者咩都好嘅，咁咧佢所呼出嚟嘅空氣 high volume suction 可能係 remove 咗好多，咁亦都係因為講效能好高 remove 咗好多。咁而呢啲咁嘅空氣咧，最後嚟講，其實嚟講咧，就只係 trap 咗喺你嗰個air vent 所排放出嚟嘅地方啊。咁所以呢個大家都即係要諗一諗呢個問題。嗱，我提出咗問題，我亦都希望可以提出解決問題嘅方法。咁就喺之前CSIP program 嗰陣時咧，我哋提出咗一樣嘢。咁我哋跟住見到好多醫生咧，佢都好有心咧，即係佢哋去諗一啲方法咧去解決。咁就包括有啲醫生咧，就喺嗰個體口度就裝一啲即係 HEPA filter 啦，咁就令到咧個空氣排出嗰陣時咧係經過過濾啦嚇。咁有啲醫生嚟講咧，就喺個排氣口附近嗰度咧，就裝一啲高效能嘅即係空氣淨化機啦咁樣嚇。咁有殺菌功能嘅，咁亦都係有機會咧係將嗰個咁嘅即係如果裏邊係有病毒嘅話，係減到最低嚇。咁就我自己嚟講咧，就嗰個氣同埋水咧都可以排去嗰個 drainage 嗰度咁樣嘅。咁但係咧有一個限制，就喺一個裝置上邊嚟講咧，就你嗰啲管道咧裏邊咧，佢要係有呢個即係 non-retraction valve 啦，咁等啲水可以倒流啦嚇。咁同埋嚟講咧，嗰個 suction 嗰個power 咧係要比一般嘅 suction 咧係高咗嘅嚇。咁同埋第三樣嘢嚟講就係我如果咁樣做法嘅話咧，我唔可以裝喺一啲即係呢個方法可以做喺一啲咧附近有食肆嘅地方。因為食肆裏邊咧，佢哋會用好多番鹼水過嚟咧就做清潔。咁如果你有咁大量嘅空氣咁樣咧，即係注入去裏邊嘅話咧，又溝埋啲番鹼水咧，會起泡起得好犀利嘅。咁有機會嚟講咧，直情嚟講喺翻人哋嗰啲咁嘅 即係佢啊，或者係講係其他地方咧就走晒啲報告出嚟嘅。咁所以呢個方法咧，大家就即係即係要留意下。咁但係我覺得咧，第一個方法同埋第二個方法嚟講咧，就其實嚟講咧就都係可行嘅。咁所以我諗大家即係譬如喺用個 high volume substance 對佢好有信心之餘咧，亦都要考慮咧嗰個排氣嘅問題啦嚇。咁所以我而家大概嚟講咧就講咗一個即係而家喺香港我哋面對個環境嘅問題之後，喺個診所裏邊可以用啲乜嘢嘅方案咧去解決。咁當然嚟講咧，而家我所講嘅嘢咧，其實都係一啲好土炮嘅設計啊！我哋未有機會咧可以揾到人咧去做一個認證，究竟呢個咁嘅set up 嚟講咧係一個最理想嘅做法。咁但係喺而家呢個環境裏邊咧，咁我都希望大家咧即係如果情況許可嘅盡量做多少少嘢，咁咧就希望可以將嗰個air ventilation 咧就即係做好佢啊！咁所以加埋你如果本身係有用呢個即係譬如 N95啊，你個 PPE 係足夠啊，你本身又做咗 vaccination 啦，你姑娘又打咗針啦，咁如果譬如有啲有懷疑嘅病人，你又做呢個咁嘅RAT test 嘅話咧，我覺得診所裏邊嘅環境咧，其實係絕對安全過咧喺食肆嘅嚇。咁所以咧就即係祝大家都即係好運啦咁樣嚇。咁同埋嚟講咧，就希望大家嚟講咧，就即係如果有啲咩問題咧，就都可以大家咧一齊提出嚟討論嘅。咁另外亦都希望大家可以咧就一路留意喺學會嘅 Facebook， 咁我哋會盡量將咧呢啲 information 咧就一路 update 咧就俾大家嚇。咁因為大家都知道咧，即係而家CHP 啊或者 HA 咧嗰啲guidelines 咧係不停咁樣轉緊嘅，咁所以我哋希望咧亦都嚟講咧就盡量咧跟貼啲，俾多啲咧就即係正確嘅 information 咧俾大家咧去做決定。OK， 多謝各位。咁咧就係喎，大家睇翻咧，我哋而家經過一段時間啦，咁留意到咧頭先咧呢個咁嘅讀數咧，咁我哋見到佢咧就慢慢咧就已經係 drop 翻啦咁樣嚇。咁我諗，所以咧就如果大家真係咧去認真去處理呢啲咁嘅即係air ventilation咧，咁個效果應該嚟講咧都係理想嘅。
好多謝好多謝頭先大家即係嗰個即係收睇嗰個video clip 啦咁樣嚇。咁我諗我會俾啲時間咧，就俾大家即係譬如即係問咗問題，或者嚟講，如果譬如大家未諗到有啲咩問題嘅話咧，你可以都寫低，即係寫低。咁我都會即係今晚咧我哋會 replay 即係今晚嘅呢個咁嘅即係 presentation。咁到時大家我哋會再咧就解答嗰個問題。咁我諗頭先大家都即係好即係都清楚，咁就即係話咧，我哋而家其實面對緊嗰個Omicron 嗰個情況係點樣嚇？咁同埋嚟講咧，就係話咧，亦都見到咧，即係而家譬如我哋牙科診所裏邊咧，即係其實有啲咩地方咧，就要即係特別注意嘅。咁正如頭先Dr Sid 所講過一樣嘢啦，就係話好多嘅measures 咧，即係個 infection control measures 啊，或者你講 RAT 啊，或者 whatever 咧，其實都冇一個100% 嘅 coverage 嘅。咁好似頭先你見到佢，譬如佢個presentation 就講到啦，譬如就算你用係呢個N95，即係譬如 respirator，咁嗰個有效率嚟講咧，就係即係80幾個%。even 就算你嗰個 respirator 係做咗呢個即係fit test 嘅。咁但係我哋亦都見到，即係有一啲 occasion 咧，即係話譬如當你係即係譬如着 PPE 啊，或者除 PPE 嗰陣時咧，都可能係有啲地方嚟講咧，就會有 contamination 出現。咁所以咧就整體個策略嚟講咧，就唔淨止係應該係淨係即係 rely on 一個measures 嘅，應該係即係 multiple 嘅，即係話咧我哋有唔同嘅方案咧，就去即係去加埋一齊。咁即係話喺而家我哋即係所面對嘅情況嚟講咧，咁我哋之前一路都 emphasize 咧，大家用一啲係即係譬如即係根據衞生防疫中心 recommend 嘅 PPE 啦，即係譬如N95啊、face mask 啊、face shield 啊、GAN 啊同埋 eye protection 啊，咁gloves 呢啲要用啦。咁診所嘅infection control 跟翻即係airborne transmission 嘅 precautions 嚟做啦，咁同埋亦都跟翻嚟講呢個 standard precaution 嚟做啦嚇。咁另外嚟講咧就係RAT 可以作為一個即係patient screening。咁但係正如頭先Dr Sid 講過啦，RAT 都唔係100%嘅。咁不過有咗 RAT 之後咧，你可以將一啲所謂高風險嘅病人嚟講咧，就係減低，或者譬如你個同事嚟講咧，佢翻嚟啦，咁佢可能就算係即係有丁丁咁多，咁但係如果佢帶咗 N95啊，咁你診所嘅 ventilation 又 OK 嘅話咧，傳俾病人機會咧就會係即係好少咁樣嚇。 而第三樣嘢啦，就係頭先我所講嘅，即係譬如個診所嘅air ventilation。咁我哋即係譬如現一個combination 咧，即係所有呢啲咁嘅方法咧，即係做埋一齊嘅話咧，咁我諗咧牙科診所嗰個即係做 treatment 嗰陣時咧，嗰個治療咧其實係安全過，即係個病人喺我哋嘅診所裏咧接受治療咧，咁其實係安全過咧佢喺食肆嗰度進食嘅。即係呢個係我嘅諗法，因為即係真係啲嘢係做得足嘅話嚇。咁亦都有好多即係醫生都曾經提過嘅，即係話咦會牽涉到一個好大個 cost 喎。咁我諗而家我諗最緊要就係即係我哋就算唔係清零，即係話我哋希望即係盡量做好啲咧。我諗course 呢樣嘢咧點都會好過咧你個 office 嚟講咧係即係完全停開啦。咁但係當然as 一個即係我經常都用一個所謂叫 risk-based 嘅 approach 嚟做啦嚇。每一個醫生每一間診所都要根據翻咧佢哋自己本身咧嗰個能力啦，或者嚟講咧佢哋個 staff 嗰個即係個 consensus 啦，或者佢哋可以應對一啲乜嘢嘅風險咧嚟決定咧，即係佢哋點樣做法。咁點解我咁樣講咧？即係話譬如好似如果譬如有啲醫生或者譬如佢哋即係譬如屋企真係有老有嫩嘅，咁譬如嫩嘅。當然喺而家 moment 嚟講咧，係做唔到呢個咁嘅即係 vaccination 住啦，或者未做到啦咁樣嚇。咁有啲老嘅，因為健康問題，可能佢亦都接受到 vaccination。咁佢哋 bear 個風險係大嘅話，咁呢啲 case 嚟講咧，我覺得嚟講咧，可能佢哋即係 routine 每一個 patient 咧，即係都RAT 咧係有需要嘅咁樣嚇。咁所以甚至佢自己同埋每一個嘅即係staff 翻嚟咧都要每日嘅。咁有啲醫生如果譬如佢覺得佢嗰個即係risk management 係好嘅，咁佢譬如所有 staff 使唔使每日一檢咧？咁我諗呢個咧係佢哋可以 up to 佢哋自己即係去決定咯咁樣嚇。咁所以但係好似頭先即係 Dr Siddharth 都講咧，即係譬如而家個 case 咧仲係一路咧 search 咁上去。咁你譬如需唔需要每個 patient 係做 RAT 嘅咧？咁我諗呢個就係 up to 咧，即係你個決定咯。咁同埋之前咧另一個因素我哋都可以考慮嘅咧，就係話之前嗰啲RAT kit 咧，即係大家都會知㗎啦，即係譬如有啲牌子可能喺萬寧買到120蚊一盒。咁但係而家我諗大家普遍已經見到個價錢咧，即係差唔多咧係因為 popular 已經係去到差唔多，我諗係18蚊至到25蚊一盒度咁樣嚇。咁所以喺個 cost 上面嚟講咧，已經冇話開始之前嗰陣時咧就係即係咁誇張。咁所以呢方面咧，大家咧都可以咧就係比較即係可以諗一諗咧就會用嘅。咁我跟住喺度咧就想講一講咧，就係而家我哋即係譬如牙醫學會即係所出嗰個指引啦嚇。Stewart 麻煩你Claudia 麻煩你可唔可以將嗰個嘅指引可以 share 喺個 screen 嗰度咁樣唔該。OK， 我等佢哋可唔可以share 到個 screen 出嚟係啦。sorry， 嗱呢份咧就唔係牙醫學會嘅指引嚟嘅，咁不過咧就係阿 Ronald 冼咧，阿冼醫生咧，咁佢就好好嘅，咁佢咧就係話咧，佢睇咗話佢同我講話 Haston， 我睇咗你哋牙醫學會嗰個即係指引啦，咁佢哋公司咧佢哋亦都嚟講咧，就即係跟住咧就做咗一份樣嚇。咁嗱，我就其實好希望咧，即係每一個醫生咧，即係佢哋嘅診所裏邊咧，就都有一份咧，就係即係類似嘅指引，即係俾你哋嘅同事，咁就會比較清晰一啲咁樣嚇。咁咧就所以咧就即係我好多謝阿 Ronald 啦。咁因為佢都話咁我介唔介意我即係譬如到時即係今日 present 俾大家睇啊咁樣。咁佢話完全冇問題嚇。咁其實大家都可以即係譬如諗一諗，即係咧都要真係寫翻低呢啲咁嘅 policy and procedure。係麻煩你 Stewart， 我想要翻牙醫學會我哋自己嗰份嚇。OK， 咁咧就嗱，我諗咁樣啦，我諗等同事即係譬如即係揾翻嗰份嘢出嚟嗰陣時咧，咁我諗就我或者同大家即係譬如講一講嗰個我哋而家大概嚟講咧嗰份 guidelines 咧嗰個內容係點樣啦嚇。咁咧就最主要咧，我哋其實咧就將即係譬如首先嚟講咧，我哋主要係針對咧診所嗰個員工咧，佢哋嗰個情況嘅。咁我哋最新嗰個指引，大家其實可以喺牙醫學會個 website 同埋 Facebook 嗰度可以揾得到嘅。咁佢哋就會係咧喺即係分咗我哋分一啲係即係如果有啲 staff 係確診啦，或者佢哋係要所謂接受嗰個所謂叫做即係 close contact 啦，即係或者佢哋係即係個住所咧就要接受所謂強檢啦，或者嚟講係即係有啲懷疑嘅話咧，咁我哋都有唔同嗰個應對方法咁樣嘅。咁而其中一個即係concern 咧，即係好多醫生都問咧，就係話有一啲情況之下，如果譬如 say 嗰個即係同事嗰個同事嗰個即係屋企人佢確診咁又應該點樣處理咧？嗱呢方面嚟講咧，咁其實我哋就將佢即係歸類咗咧，即係佢係即係 close contact 啦。咁如果佢係 close contact 嘅話，咁你就睇一睇翻我哋即係牙醫學會嗰個指引嚟講咧，即係譬如其他同學如果係都有同佢 close contact 嘅話，咁應該點樣處理？如果其他同事唔係 close contact 嘅話咧，咁大家又點樣處理？咁根據最新嗰個咁嘅guidelines 嘅話咧，咁其實就只係佢哋就會係 define 咧，即係話咧如果你係有一個full PPE 喺個診所裏邊嗰度嘅，你哋亦都冇話咧就喺短距離，即係大家一齊食飯嘅話咧，咁其實咧就唔係即係或者係冇戴口罩，即係做任何接觸嘅話咧，其實就唔構成一個 close contact 嘅。咁所以呢個我諗咧，就大家即係都睇翻呢個即係新嗰啲咁嘅即係最新我哋嗰個guidelines，咁大家就會見得到咧，就即係呢一樣嘢咁樣嘅嚇。咁另外仲有一樣嘢咧，就係關於嗰個vaccination 嗰個咁嘅vaccination 嗰度，咁就都有醫生咧就問過。如果嗰個病人冇打針，可唔可以即係拒絕佢即係求診咧咁樣嚇？咁我諗嗱，呢個咧就即係喺個法例上邊嚟講咧，咁其實真係要視乎你嗰個即係情況，即係視乎你診所嗰個即係個情況嗱冇，我諗就咁樣講。你如果譬如你覺得你應付唔到嘅，或者你覺得個風險係即係太大嘅，咁我諗喺而家呢個階段咧，即係唔會話即係有人會話你係一個即係專業失德咯咁樣嚇。咁所以我諗呢方面嚟講咧，即係大家就要自己衡量下，究竟你個診所可唔可以咧，就係即係應付到咧，就係呢一樣嘢咯咁樣嚇。OK， 咁咧就阿 Stewart 麻煩你去我哋嗰個table 嗰度啊，唔該係啦啊。係一路 scroll 係啦 ，OK 嚇，咁嗱，我而家就咁樣，大家你見得到啦嚇，咁其實基本上咧，我哋就分咗同即係你個同事，如果譬如佢有唔同嘅情況，即係話基本上佢係確診啦，咁佢係close contact 啦嚇，或者嚟講佢係需要做一啲所謂叫做即係強檢或者係而家唔係叫強檢啦，因為新 update 咗咧就叫做一個risk-based 嘅testing strategy，咁同埋嚟講，有一啲 staff 佢只係懷疑自己中咗或者擔心嘅話咧，佢應該咧係即係點樣做？咁我諗呢度咧就即係個表嘅即係打橫嗰個 column 咧就係唔同嘅 scenario 啦。咁而打戙嗰個 column 咧就係話咧你有啲咩 action 咧就要 take。咁嗱因為頭先我諗大家都知啦，即係阿 Sid 都講過咧，政府係轉得好快嘅。咁但係我哋亦都希望咧，就即係我哋盡量跟得到佢。咁即係話咧 ，whenever 佢有啲乜嘢嘢咧係即係 update 咗嘅話咧，咁我哋咧就都會咧喺我哋嗰個 list 度 update。咁所以大家就即係密切留意我哋嘅Facebook 啦，咁同埋留意我哋嘅 website 咧，我聽我哋嘅 list 咧會有一啲個更新咁樣嘅嚇。咁呢個就即係主要係而家我哋即係可以能夠咧就係即係俾到提供到俾大家嘅資訊。咁就至於嚟講另一方面咧，喺我哋牙醫學會嗰個 Facebook 嗰度咧，亦都有講關於咧就即係啲唔同嘅即係譬如包括啲RAT 邊度有得買啦，啲filter 啦邊度有得買啦。咁我哋都盡量咧就 provide 呢啲咁嘅 information 咧就俾大家嘅。OK， 咁嗱好啦，咁我睇下大家有冇啲乜嘢譬如問題咧就即係想問嘅。咁我可以喺即係今日喺呢個時間個 section 度咧，我可以即係答緊即係部分嘅問題。我到今晚嗰陣時咧，如果大家我再 replay 呢條片嗰陣時，大家仲有啲咩問題嘅話咧，咁我都可以再答到大家咯。
Haston 我係 Daniel 你好。
Hello 你好嚇。
多謝晒你今日做咗呢個咁嘅講座，非常有幫助嘅。我想問問你而家on screen 睇到個 updates on dental clinic management 係牙醫學會嘅，會唔會啲會員有機會可以做一個參考咧？或者佢哋 可以會唔會喺個網址度揾得到？咁佢哋可以 print 出嚟俾佢哋。
有嘅，呢個喺我哋我哋而家會擺咗上我哋我哋會有兩個地方擺到，我哋喺我哋嘅Facebook 嗰度。咁另外咧就喺我哋嘅 website 嗰度咧係可以揾得到嘅。咁佢哋可以
有埋中文版嘅嗬？
有中文版、中英文版都有嘅。咁可以咧就有一個參考咁樣嘅。
唔該晒，唔該晒。
係啦，
thank you。
係啦，咁同埋就一樣嘢就係因為咧曾經有啲即係會員都同我講咗話可唔可以即係寄到俾佢哋啦咁樣嚇，咁但係個情況你知而家嗰個變化實在得好快，咁我就好希望咧即係啲會員嚟講咧即係體諒咧，即係話我寄咗俾你嗰陣時咧嗰份嘢咧其實已經係 outdate 咗㗎啦咁樣嚇，咁我諗過去嗰個禮拜咧即係好多嘢都轉咗都即係5、6次，即係我啱啱寫好呢份嘢嗰陣時咧其實係上個禮拜5嘅，咁但係即係你大家都見到咧，即係淨係呢3日咧，我諗都轉咗好多。咁所以我哋會盡量一路 keep update 佢哋啦，咁樣嚇。
唔該晒。
係冇客氣嚇。係想同埋睇下其他嘅醫生有冇問題。咁嗱，我哋今日呢個即係 presentation 咧，就我哋會錄影咗。咁然後今晚咧，我哋就會係即係再喺Facebook 啦，同埋嚟講係我哋用我哋嘅 YouTube link 咧，就播翻俾即係大家睇。咁我今晚咧，我都會喺度咧，就係話如果譬如大家有啲咩問題嘅話咧，咁我都會盡量咧就解答大家嘅問題咁樣嘅，即係 concern 關於譬如係個 infection control measures 啦，或者嚟講嗰個 clinic 嗰個protocol 係點樣啦嚇。咁但係我就好希望大家咧，即係話譬如如果睇咗我哋牙醫學會呢份咁嘅即係譬如management 嘅指引，咁大家都為翻自己嘅診所嚟講咧，即係做翻你哋自己 practice 嘅 guidelines 咁樣啦嚇。OK， 咁我頭先就見到咧就係有個問題嘅，咁就係話咧如果個同事咧就係拒絕即係打針嚇，拒絕打針，咁咧就究竟可唔可以即係炒佢？嗱呢個係一個好現實嘅問題。咁其實政府嚟講咧，就亦都嚟講咧，就好似係即係立緊法，就係話咧，如果即係同事係即係拒絕打針而僱主解僱佢咧，就唔構成一個即係violation 咁樣嘅。咁但係個法例咧就仲未走咗出嚟，咁所以呢個又係要等少少時間。但喺而家呢個 moment 嚟講咧，咁咧就即係會唔會構成一個不合理解僱咧？咁仲係有一啲未知之數啦咁樣嚇。OK， 咁跟住就有一個問題就問Is there any case report of COVID-infected patients infecting dentists after treatment？嗱 ，so far 咧我未聽過嘅，咁甚至即係譬如之前咧，好似譬如衛生署係有即係同事同埋有姑娘係確診咗啦。咁我問翻衛生署嘅同事嚟講咧，佢哋嘅 tracing 嚟講咧，發覺嚟講咧就同 patient treatment 咧就冇關係嘅，咁就好大機會咧，即係係社區感染嘅。咁所以呢方面嚟講咧，到目前嚟講咧，即係牙科診所即係 so far 我哋都仲係即係zero case 啦。咁但係當然，即係我係知道咧，即係有啲醫生即係或者同有啲姑娘咧，佢係感染嘅。咁但係咧，通常嚟講咧，就係都係咧佢哋嘅住宅啦，即係譬如住宅裏邊咧，佢哋係有一啲cluster 嘅 infected case 咧，就導致呢個情況出現咁樣嘅。OK， 咁個問題就跟住一個問題就話 ，if under quarantine, if it is counted as a sick leave， 嗱呢個又亦都係一個大家要留意啦，因為咧目前嚟講咧未有法例，即係未有法例即係將呢個quarantine 咧 consider as sick leave。咁但係我聽講咧，政府嚟講咧，而家係考慮緊咧就立法，因為佢哋通常嚟講咧，即係一立法嚟講咧，佢就要喺599嗰度咧就寫一條，而家唔知去到 Q 定 P 㗎啦咁樣。咁咧就似乎個立法程序嚟講咧，就可能都即係有少少時間啦。咁所以你見到有佢由之前咧，即係譬如14日嘅 quarantine 就改咗做7日，咁就由 RAT 又 accept。咁但係我相信咧，就係話你個同事咧即係譬如佢 RAT positive 咗之後咧，佢係要同呢個咁嘅即係政府嗰度嗰個即係熱線嗰度咧登記咗，佢先至可以咧係即係 consider 咧，即係佢係即係 sick leave under quarantine 咁樣嘅嚇。咁所以我諗就唔可以就話醫生啊，我有個 RAT 我 positive 咗啊，咁我唔翻工啦咁樣嘛，咁你計翻病假俾我啦。我諗咁樣其實就唔得嘅，咁佢一定係要登記咗喺嗰個熱線嗰度啫，先至即係 consider 一個即係一個確診嘅 case 咧，就先至可以將來咧先至可以攞到呢個福利咯。
Haston，我想問多一個問題啦，唔好意思。想問即係你頭先話建議用 RAT 啊，即係啲病人睇之前用 RAT。如果個病人係拒絕做 RAT 的話，咁你都為咗個診所啲員工着想，你話唔睇個病人嘅話咧，會唔會構成一個構成一個問題咧？
嗱，呢個我唔可以即時答得到你。咁不過咧，就我諗而家即係如果譬如佢係即係譬如冇 RAT，你又覺得你診所嘅即係能力啊，或者你我嗰班又唔係負壓房啊，或者咩咧？咁或者你有啲姑娘可能又未 vaccinated 嘅話咧，咁我覺得即係如果你即係 refuse 佢嘅話咧。我覺得應該唔會係去到一個所謂即係專業失德嘅地步啦。咁所以我諗呢個我哋都會即係 further seek for more advice on 呢一樣嘢咁樣嚇。係，咁即係另一個問題就係話，你可唔可以喺呢個診所度門口燈寫咗出嚟話，即係希望所有病人睇病之前都要做咗 RAT test，就算做呢個咁嘅聲明，都會唔會構成一個問題喺度咧？ 我相信應該就唔會嘅，咁所以我諗大家都可以即係都可以即係諗啦，因為嗱我而家我自己嗰個做法嚟講咧，我就係即係啲 patient 即係打電話嚟啦，咁我都會即係通知佢就話你即係最好自己即係做咗個 RAT，咁如果你見到係 negative 嘅，你先至好過嚟啦咁樣嚇。咁如果佢話我屋企冇 RAT 啊，咁我話你上到嚟我都可以幫你做，咁但係即係我哋個要求咧，你都係要 RAT 咧係即係 negative 咧就先至得嘅。咁因為點解咧？因為我過往嚟講咧，亦都問過一啲即係譬如西醫，咁佢哋其實好多即係好多地方咧，佢哋都係要個 patient 咧，即係提供一個所謂叫 PCR test 嘅 negative，即係之前嚟講咧，有個 PCR negative test 咧，佢哋先至肯同佢睇咁樣嘅。咁但係我又 so far 又未聽到有醫生有呢樣嘢俾人哋投訴，就話佢係即係專業失德咁樣嚇。咁所以我諗喺而家呢個非常嘅即係環境之下咧，咁我諗如果佢係即係唔願意或者唔知基於咩原因咩咧，你唔能夠提供個 RAT 或者唔肯或者佢或者係其他嘅情況嘅話咧，我諗其實大家都唔需要太過擔心咯咁樣嚇。
OK， 唔該曬 ，Haston，thank you。
OK， 我見到有條問題咧，就any subsidized or financial relief we can apply from the government at the moment。暫時我理解咧，我哋個行業就唔屬於嗰啲即係要求被關閉嘅行業，咁所以我就見唔到呢樣嘢。咁不過我諗呢樣嘢就睇下即係睇下可能到時即係譬如 council 即係都傾一傾，睇下譬如政府有啲乜嘢嘅即係支援方案啦咁樣嚇。咁呢個我可以留翻阿會長遲啲答你咁樣。係 ，hello， 大家好。咁咧就嗱，我諗頭先嗰個 section 咧就即係啱啱係即係今朝個 replay 啦。咁我就今晚其實我而家都會繼續喺度嘅。咁就同大家嚟講咧，就即係再即係譬如 recap 翻我哋今朝所提嘅嘢啦。咁同埋嚟講咧，就做翻即係有一啲我晏晝嗰段時間咧，咁其實都收到好多醫生嘅 WhatsApp，佢都 send 啲即係短信俾我。咁有啲嘢咧就想即係想 clarify 翻或者問翻咁樣嘅。咁我就做翻即係少少整理啦。咁晏晝就有個醫生即係 send 咗 message 俾我，咁佢就即係同我即係討論啦。咁佢話譬如 Omicron 嘅 size 咧講緊嚟講咧，大概係50個 nanometer 至到140個 nanometer 嘅啫。咁其實我哋而家即係譬如所用緊嘅，譬如即係啲即係 N95啊 face mask 即係或者係respirator 啊，或者譬如我哋而家用緊啲 HEPA filter 咧，其實嚟講咧係 work 唔 work 嘅咧 trap 唔 trap 到佢嘅咧咁樣嚇。咁嗱我諗而家譬如話手頭上你見到呢份 paper 咧，就講緊 transmission of COVID-19 virus by droplets and aerosol 嚇。咁呢份 paper 嚟講咧，就係喺呢個2020年啦。咁其實係即係比較啱啱個疫情開始嗰陣時嘅 paper 嚟嘅。咁但係其實都講得好清楚咧，其實嗰個virus 咧，即係佢仲到而家今時今日咧，佢都係 classify as 一個咧係 transmission 咧 by droplet aerosol 嚇，或者一個 short range 嘅air transmission， 即係話咧佢唔係話純粹咧係單靠咧佢自己個粒嘢咧喺個空氣嗰度漂浮嘅。咁通常嚟講咧，佢都係會黐咗喺一啲咧就aerosol 啦，或者一啲更加細即係好微細 aerosol 咧叫 bio aerosol 咧，就喺嗰度咧就走嚟走去嘅。咁意味住咧，而家譬如我哋所用嘅譬如 HEPA filter 啦，或者我哋個 N95啦，咁 which is 佢可以係隔到譬如 PM1 其實係咩嘅 size 咧？就係0.1個 micron 嚇。咁咧就 即係可以 trap 得到咧，即係咧呢啲咁嘅即係 particles 啦，即係呢啲係帶住個病毒嘅 particles 啦。咁但係我正如我頭先即係譬如所講過啦，同埋今朝Dr Siddharth mention 過啦，我哋冇一個方案，即係冇一個方案咧係100%咧係可以就將嗰啲咁嘅即係咧病毒嚟講咧係阻隔嘅嚇。咁我哋一定係用好多唔同嘅方案咧，就加埋嚟咧就一齊做嘅。咁而成個套路咧，唔係淨係話Haston 我喺邊度買部機，買咗邊度，我買咗部機咧就 OK 啦，或者話我用咗你用邊隻N95啊，我跟翻嚟用就 OK，即係唔係咁啊？成個套路咧就係話咧，你由開始嗰陣時，即係你就要 bear in mind，你首先你要有一個策略，即係一個政策去點樣做，然後跟住咧你個策略裏邊咧，你有啲咩防線咧就會 set 咗喺度。咁而家我哋所提供俾大家個即係防線嘅設立嚟講咧，主要嚟講咧有幾個部分。最緊要個部分嚟講咧，就係嗰個 triage 即係分流嗰度。你第一樣嘢，即係譬如你知道你個 patient 大概個情況係點樣先，即係佢有幾危險先啊。咁以前咧，譬如未有 RAT 嗰陣時咧，我哋真係單係靠問嘅啫啊。你有冇同一啲確診人士有接觸過啊？你大學需唔需要接受強檢啊？或者嚟講咧係即係你屋企人啊，或者其他情況係點樣嚇？咁而家有咗 RAT 咧，咁其實我哋就多咗一個工具，即係話喺我哋即係俾會員嘅 triage form 裏邊嗰度咧。咁我哋如果譬如見到一啲可疑嘅地方嘅，咁我哋咪同佢即係做個 RAT 啦嚇。甚至如果譬如好似頭先Dr C 所講啦，個情況咧係嚴峻嘅嚇，個 case 咧可能每日咧以即係幾萬咁樣咧就上嘅話咧，咁我可能嚟講咧就係話你唔好理佢啦。總之咧就係咧。佢要提供個 RAT 俾你啊，咁佢係 negative 嘅，咁佢先到過嚟啦。或者嚟講咧，佢嚟到嚇，或者你都唔係好肯定啦，你再同佢做一次嗱。我諗病人咧，即係佢都會考慮嘅，即係話咧，第一佢即係佢都想去一個安全嘅地方，即係嗰度睇。咁如果你話你俾佢知咧，你係個個都做嘅，我諗佢唔會反對嘅，即係佢做埋，咁佢又知道佢今日都安全，咁佢跟住晏晝去見人，佢都放心啲啦咁樣嚇。咁所以咧就係即係變咗而家個 triage 裏邊咧，我哋其實多咗個工具咧，就係嗰個即係 RAT 可以幫到我哋手。咁好啦，咁我哋用咗我哋嘅 triage form 咧，用咗佢 RAT 咧，咁我哋其實就已經係隔咗咧第一陣咧即係比較高危嗰啲咁嘅病人啦。點解咧？因為如果嚴格嚟講咧，我哋 treat 嗰啲所謂叫做 airborne即係 infection 嘅 case 咧，我哋嘅其實診所咧係冇咁嘅足夠嘅能力嘅，因為你要揾間負壓房。咁我諗香港有邊間即係有幾多牙科診所係即係可以 set 到個負壓房？我相信唔多。咁所以咧，我哋只係話咧就係我哋將嗰啲高風險嗰啲 case 咧，盡量清得幾多得幾多。但係一個半個即係漏網嘅，我哋有陣時都可以勉強應付得到。咁好啦，去到我哋做嘢嗰陣時嚟講嘅，譬如我哋有足夠嘅 PPE 啦，即係有呢個即係口罩啊，有 face shield 啊，有膠啊，有 glove 咁樣咧，咁嗰度係第二個，即係譬如防線。咁再加埋我哋啲 hand hygiene 係做得好啦咁樣嚇。咁同埋嚟講，我哋就算即係有好多醫生都話，如果我啲 N95都做唔到嘅fit test 嘅，咁我其實不如做 surgical mask 啦。咁但係我諗頭先你見到阿 Sid 所講啦，即係話係有分別嘅嚇。咁同埋你頭先見我條片裏邊咧，你見到我講嘢嗰陣時咧，嗰個 mask 咧，即係講嘢嗰陣時咧，就即係呼氣嗰陣時咧，佢就脹咗嘅。吸氣嗰陣時咧，佢就凹咗佢嘅。咁我諗其實大家都知道咧，你個面罩咧，即係貼或者唔貼咧，其實好容易知嘅嚇。咁大家即係揀幾隻試一試邊一個感覺係最好嘅話咧，咁個效果就最理想嚇。因為當然啦，最理想你係可以做到呢個咁嘅 fit test。咁但係如果做唔到 fit test 嗰陣時咧，我哋都盡力咧，即係去感受一下咁個面罩咧，即係咪貼啦咁樣嚇。咁嗱，咁跟住除咗個 PPE 之外，我哋個 anti-material 嘅antivirus 嘅 mouth rinse 咧嚇，可以係呢個chlorhexidine 啦，咁可以係一啲iodide啦，或者係啲 peroxide 咧，都係 work 嘅。咁亦都有 study 去證明咧呢樣嘢咧係 work 嘅。咁所以呢個亦都係我哋防線裏邊即係其中一個部分咧係 OK 嘅。咁就至於 rubber dam 嚇，咁咧就嗱如果即係情況許可嘅，咁啊最好嘅落 rubber dam 啦。咁但係你話我落唔到 rubber dam，我係咪唔做咧？我又唔覺得一定係嘅。咁因為所以我諗呢個就睇下大家嗰個 preference。咁如果譬如你可以即係譬如落到 rubber dam 嘅，咁你咪可能即係多個保障啦。但係你落唔到，你其他嘢做得足嘅話，咁其實並不表示咧，即係你係 exposed to 一個 great danger。咁所以我哋 triage 做咗一陣啦。咁我頭先講嗰啲嘢，即係譬如 PPE 啦，攞口水啦嚇，咁啊跟住有啲情況你可以落到 rubber dam 嘅，咁又可以即係譬如隔一陣啦。咁其實你所 expose 嘅風險咧就少啲。好啦，再去到如果譬如我個 high volume suction 再 remove 咗佢出嚟嗰啲咁嘅aerosol 啦咁樣嚇，咁啊其實你個風險又再少啲嘅咯喎咁樣嚇。咁亦都有一啲 study 咧，即係早期喺個 COVID-19 開始嘅 study 嗰時咧，係 mention 過咧，就係話當我哋嗰個即係個 dental 嘅 aerosol generation procedure 咧，其實嚟講咧唔係 produce 得咁多即係咁多一啲即係所謂係viral content 出嚟嘅啫嚇。咁最主要都喺嗰條 waterline 嗰度嚟嘅啫咁樣嚇。咁但係話雖如此咧，我哋都唔可以掉以輕心啦，因為 Omicron 嗰個傳播能力實在係好高，咁所以我哋都係要即係要即係 take care 啦咁樣嚇。咁好啦，到譬如再當我哋個 high volume suction 都吸唔晒啲嘢啦，剩翻低嗰啲，咁我哋就可以擺我哋嗰個 air ventilation 嗰度啦，即係譬如可以譬如當佢漂浮喺我哋房裏邊嗰陣時嘅話咧，咁我哋如果個 air ventilation 可以做得好嘅，嗰個換氣量咧係足夠嘅，我哋亦都有足夠嘅 mechanical filter 去 filter 咗嗰啲咁嘅即係 particles 嘅話咧，咁我哋個 risk 咧咪可以又再減低啲咯咁樣嚇。咁所以即係成個流程咧，唔係淨係一樣嘢兩樣嘢，而係成個咧你要一個好清晰嘅思路咧，你知道你個診所嚟講咧係點樣去部署去應付呢樣嘢嚇。要記住咧，我哋而家係打緊一場仗嚇，咁呢場仗嘅敵人咧係亦都來勢洶洶嚇，咁所以我哋一定係要即係唔好話淨係我單丁淨係一個地方布防，因為如果我布防嘅話咧，我要好多地方咧一齊要同時去做咁樣，咁所以我哋即係要有呢個咁嘅概念咧，咁我哋先至可以咧即係令到我哋即係喺呢個戰役裏邊咧即係立於一個不敗之地啦咁樣嚇。咁咁頭先亦都好啦，咁跟住咧就我晏晝有另一個問題啦，咁就係有醫生咧就話關於嗰個ACH 嗰個 air change per hour 同埋嗰個 Ferro time 係啦，咁咧就Stewart 唔該，我份CDC 另一份 paper 唔該嚇，關於個 ACH 嗰度嘅嚇，第二份 paper 係啦 ，OK 嗱，咁其實咧就講緊咧就呢個表，呢個 CDC 嗱，我頭先嗰啲 paper 咧我都會擺上喺牙醫學會嗰個咁嘅網頁嗰度嘅，咁大家即係有時間都可以睇下噶啦嗱。ACH6 嗰度咧，你見到嚟講咧就係係啦，而家我哋衛生署咧就去 recommend 嗰個咁嘅即係數字啦。你見到佢有兩個 figures 嘅，一個 figures 咧就99%，就係即係 remove 咗嗰啲咁嘅即係譬如airborne contaminant， 佢係用 airborne contaminant 呢個字嘅嚇。如果去到99.9%咧，就去69分鐘，即係差唔多係45分鐘至到1個鐘頭時間啦嚇。你個 ACH 越高嘅話咧，咁咧就嗰個能力咧，其實就越好嘅咁樣嚇。但係咧就係個 ACH 咧，佢點樣去定出嚟咧？其實有好多個考慮嘅，因為你有啲情況之下咧，譬如你間房，當然啦，呢個 ACH 所謂嗰個叫即係嗰個換氣量咧，通常講個先鋒啦。但係咧有一個限制咧，就係喺香港咧，唔同喺外國嗰啲即係診所，咁譬如我有好多喺加拿大嘅同學咧，咁佢哋有自己咁個診所咧係即係可以打開窗嘅嚇，咁可以即係譬如咁開窗，即係開窗做嘢，咁開晒啲窗啊，再加埋啲風扇喺度吹嘅話咧，咁個 ACH 嗰度一定係高嘅。但係咧香港，尤其是如果你個診所喺嗰啲即係寫字樓啦玻璃幕牆嗰啲咧，咁嗰個 ACH 咧就真係咧好 limited 啦。咁所以呢個咧我哋一定係要即係。要真係做一個所謂嗰個利用嗰個 mechanical air filter 嗰個方法咧，嚟增加咧，即係對嗰個空氣量嗰個過濾咧，就先至可以達到咧一個比較理想嘅做法咯咁樣嚇。咁就所以大家呢個咧都可以咧就留意下。咁但係如果譬如你起碼即係譬如有6個 ACH 嘅，咁呢個就嗰個 minimum 即係 requirement 咧。咁你做到呢個其實嚟講咧都唔錯，因為我哋仲有其他個工具嘅，除咗係即係我哋個 air filter 之外咧，咁我哋可能仲有 high volume suction 咁樣嚇，咁所以咧呢個咧我諗大家即係唔使話即係又要好太過擔心樣，因為呢個係防線其中一個部分。咁如果依條防線你可以做得好嘅，咁其他嘅咁你可以放心啲啦。咁如果譬如呢條防線你真係好大限制嘅話咧，咁你咪其他地方又要做好啲咯。咁所以喺我哋布防嗰陣時咧，我哋一定係有個策略咧去應對點樣做。好啦，咁如果譬如我哋跟住即係跟住我哋下一樣嘢會講啦。好啦。嗱，當你啲防線 set 好晒啦，咁但係有陣時即係都會有一啲情況會出現嘅，就係好啦， 如果譬如真係你個病人確診咗，跟住話翻俾你知，咁你跟住又要點樣做咧咁樣嚇？咁所以呢個咧亦都係咧，你喺事前咧，即係尤其是而家咧，你一定要諗定㗎啦。即係話咧嗱，如果到時真係譬如有一個病人佢第二日打翻嚟，喂，醫生，我原來咧就其實琴日朝我都咳嘅，不過我就冇話俾你知。咁不過我又見我個RAT 係 negative，咁所以咧我就上咗嚟睇。咁不過今日咧我就唔好意思啦，我中咗啦咁樣嚇。咁你亦都要即係你要有一個 protocol 咧去應對啦，即係話跟住我咪診所咪即刻可能會即係譬如可能收一晝或者收一日，我哋做個徹底消毒。咁好多醫生都問我所謂個 fluid disinfection 咧係咩咧咁樣嚇？咁如果你睇翻咧，就係即係衞生防護中心咧，其實佢有兩個guidelines 嘅，一個咧就係叫 healthcare setting 嘅即係disinfection 係點樣做啦。咁另一個 guidelines 咧就係喺個 working place 點樣做。咁其實咧佢只係講咗兩隻，即係講咗幾隻字嘅啫，就係用1:49嘅漂白水就抹啦，即係我嚟拖嚟抹啦咁樣嚇。咁或者嚟講咧，跟住用呢個酒精咧就去抹嗰啲咁嘅working surface。咁呢個其實就係嗰個所謂叫做即係 full disinfection， 即係你係即係抹得勻循啲所有地方都抹。咁但係如果譬如你個診所其實已經係跟足晒即係譬如嗰個 infection control guidelines， 即係CHP 嗰個即係infection control guidance for clinical setting 嘅話咧，咁其實你使唔使再做 full disinfection 咧？咁我覺得就未必一定要即係要 off 2日時間咯。你可能 off 1晝都已經足夠啦。咁所以咧呢個咧就要睇下你自己係咪真係咧平時做得足嚟去決定咯咁樣嚇。咁就呢個就係即係譬如有啲醫生今日亦都問我啦嚇。咁第三個即係譬如問題咧就係話究竟我哋譬如需唔需要咧？就即係如果有病人確診，我哋需唔需要即係特別通知翻咧？即係其他到過嚟嘅病人，咁咧就話聲俾佢知啦咁樣嚇。咁我問過其他即係譬如唔同嘅單位啦咁樣嚇，咁佢哋即係都話翻俾我知咧，就係話如果譬如咧佢哋即係清楚當時嘅同事咧都係咧即係 full PPE 嘅嚇，咁所有啲嘢都係做得足嘅話咧，咁其實根據衞生防護中心嗰個咁嘅界定嘅咧，其他嘅同事咧，即係其他即係當時嘅同事啦，同埋其他嘅病人咧，其實都唔算一個密切接觸者。咁如果喺呢個情況之下咧，咁其實你就冇需要咧，就特別咧就去通知佢哋嘅啫嚇。除非你嗰個病人原來咧佢就可能咧喺即係外邊嗰度咧，咁就同你個姑娘咧就大家除低咗口罩喺度傾偈啊，或者咧就佢帶咗啲嘢上嚟食，咁然後大家就一齊喺嗰度食咁樣嚇。嗱，咁咧就有機會啦嚇。咁但係如果譬如唔係一啲咁嘅情況出現嘅話咧，其實佢就唔算係一個密切接觸者，咁你亦都冇需要咧就即係譬如主動通知佢哋，除非衞生防護中心話俾你知咩醫生你幫手通知你啲病人啦，咁佢哋可能咩喎咁啦。咁如果咁嘅情況咧，咁就你一定要聽佢衞生防護中心嘅指示啦。但係 otherwise 咧，如果冇佢一個明確嘅指示嘅話咧，咁我諗呢樣嘢咧，大家就唔需要咁擔心咯。OK， 好，咁咧就睇下先有醫生有啲問題嘅，咁我諗我就即係盡量咧都答翻啦嗱。If we can't buy N95 嘅 mask, no stock in Hong Kong，會 KN95 嘅 mask 足夠 OK 嘅。KN95 嘅 mask 咧，即係只要係認證咗係一個surgical respirator 咧就 OK 啦。嗱以前咧衞生防護中心咧係用 N95 嘅，咁但係咧就我諗即係譬如過咗而家一段時間啦，咁其實嚟講咧喺市場上邊咧都有好多咧就係surgical respirator 咧係合用嘅，咁所以你睇翻衞生防護中心嘅指引，咁譬如好似有啲係即係譬如歐盟認證嗰啲啦，就係嗰個FFP 嗰啲啦，FFP2 或者 FFP3嗰啲咧，其實咧就都係咧就 OK 嘅咁樣嚇，咁所以咧就同埋而家市面上咧其實嚟講咧係有好多即係 surgical respirator 嘅，咁你只要睇翻佢哋嗰個即係標準，咁就 OK 啦。咁亦都有啲醫生問我，好似譬如 say 3M，咁佢有啲即係譬如8250咁樣嚇，咁嗱大家咧就要留心啦，因為咧有一啲 respirator 咧佢唔係 surgical 用嘅。嗱 surgical 用嘅 respirator 咧，佢最主要咧佢係防水嘅，即係話佢係splash resistant 嘅。咁嗰啲咁嘅 mask 嚟講咧，咁咧就都係最理想啦。咁好啦，如果佢唔係防水，但係我又覺得嗰隻係真係啱我戴又戴得舒服嘅，得唔得咧？ 得嘅，因為咧喺即係喺當即係早2年前嗰陣時個疫情好犀利嗰陣時咧，CDC 係俾咗個指引，即係話咧，如果譬如你係用緊一啲咧non-surgical 嘅 respirator，OK，不過嚟講咧，你一定要加埋個 face shield 一齊用，因為個 face shield 咧可以幫你擋嗰啲水，咁你個 respirator 咧可以發揮到咧，即係佢應有嘅功用咁樣嚇。咁所以咧有一啲唔係即係喺而家咁嘅情況啦，如果有一啲唔係即係屬於係 surgical grade 嘅respirator 咧，其實咧都係可以用嘅，不過你就一定要係即係有足夠嘅防水設施咯。咁但係我諗而家大部分醫生咧就都係會用呢個face shield 啦。嗱，當然我亦都有啲醫生同我講過，因為佢本身咧用顯微鏡做嘢，或者佢用頭燈做嘢嘅，咁佢戴住個 face shield 咧就好唔方便。咁所以咧佢咧就用呢個goggles 啦，即係 eye goggles 啦。O 唔 OK 咧？嗱eye shield 或者 eye goggles 咧係可以接受嘅。但係咧，普通嘅眼鏡咧，即係一般你個近視眼鏡或者老花眼鏡咧，衞生防護中心係唔 consider 一個 eye protection 嘅，咁所以呢個大家咧你就要留意啦咁樣嚇。咁如果譬如你係用 goggles 嘅話咧，你就唔可以用嗰啲咧唔係 surgical 嘅 respirator，咁呢個大家要清楚啦。OK， 咁咧就OK， 咁咧就有個問題就問 How about UVC 嘅 disinfection？ 嗱，UVC disinfection 咧喺外國嘅literature 嚟講咧，係有用嘅，咁不過嚟講咧，如果你用個 UV 嗰陣時咧，你間房咧就要即係要清零嘅，即係要唔可以有人喺度嘅咁樣嚇。咁所以如果喺外國裏邊咧，如果佢哋有 surgery 咧，譬如佢有即係6個 surgery，佢只係用4個嘅，咁可以大家輪流咧，即係輪流開嗰個 UV 嘅話咧，咁係 OK 嘅。咁不過就即係你睇下你即係 office 咧有冇咁嘅 luxury 咧，即係譬如有幾間房，有一間咧就即係可以佢俾你咁樣我嚟 rotate 法咯咁樣嚇。因為咧你個 UV 咧就唔可以開咧。就閂燈咧就算數嘅，因為咧佢 UV 咧都有分一啲 high energy 啊或者 medium energy，咁所以你要睇翻你嗰個UV 個 spec 咧，就話佢要照幾耐，即係佢又要照得勻，要照幾耐之後咧，佢先至可以發揮到嗰個效用咯咁樣啊。OK， 咁咧就OK， 仲有個 questions 咧就係睇下先。OK， 咁咧就有醫生問點樣計嗰個所謂叫 ACH 啦？個 ACH 咧個計法嚟講咧就其實就好直接嘅。咁我就睇下先，我Siddharth 將嗰個 paper scroll 落去裏邊啦嚇 ，scroll 落下邊嗰度係啦嚇。OK， 好啦，高翻啲係啦。OK， 嗱大家見到啦嚇，最低嗰度 Q over V，Q 係咩咧？就係 Q 就係 airflow rate in cubic feet per hours 係啦，即係話咧每小時嘅空氣流量嚇，即係你嗰部機咧，即係嗰個先風量或者佢個送風量咧係幾多嚇？咁然後咧就係嗰個 room volume，即係話你間房咧嗰個大細係啦。咁所以如果譬如 say 你間房係譬如10尺，sorry 係10尺啦，乘10尺啦，咁然後乘8尺嘅話，咁你間房嗰個 size 嚟講咧，咪800個立方尺咯咁樣嚇。咁如果譬如你嗰個即係個機嗰個送風量嚟講咧，譬如 say 可能係16000嘅咁樣嚇，即係16000嘅即係立方尺per hours 嘅話咧，咁你個 ACH 咧咪可以係去到呢個其實係去到呢個差唔多係20咯咁樣嚇。咁呢個就係嗰個大概嗰個計法。咁嗱我哋用 HEPA filter 咧，我哋有個好處嘅嚇。咁咧就亦都可能係亦都我哋喺香港限制啦，因為我哋喺香港咧嗰啲即係診所咧，佢唔係好大間啊，嗰間房通常都好細嘅，咁所以你部 HEPA filter 咧，即係其實就唔使話即係要裝啲好大座咧，咁其實都已經係 serve 到個 purpose 嘅啦咁樣嚇。咁但係最大問題係邊一啲咧？就係嗰啲 open clinic，即係話咧有好多即係譬如好似有啲即係箍牙醫生啦，咁佢哋嗰個碑可能係一字排開有7-8個碑嘅咁樣，咁嗰啲就要點樣做咧？咁我哋喺即係外國同學嗰啲經驗咧，咁佢哋就落一啲所謂叫做塑膠嘅屏障，即係 plastic 嗰啲咁嘅嗰啲咩嗰啲唔係簾，即係類似肉簾咧，但係佢又唔係即係軟賴賴嘅，佢係硬身少少嘅。咁咧就將嗰間房咧就做咗個即係類似一個透明嘅 partition 咁樣咯嚇。咁呢個就係另一個方法咧，就可以咧就考慮嘅咁樣嚇。咁所以咧就open area 咧嗰個處理方法係困難啲嘅，咁我亦都有一份 paper 咧，係按即係一啲 open area 咧嗰個咁嘅air ventilation 嘅處理，咁我亦都會咧就擺上喺我哋嗰個 website 度咧，大家可以參考一下啦。OK， 咁我再睇下有冇其他題目先，係啦。 問題先係啦。OK， 嗱，我暫時嚟講咧就即係只係見到有咁多嘅即係題目啦咁樣嚇。咁如果譬如大家嚟講咧係仲有啲仲有啲咩題目嘅話咧，咁我哋都歡迎咧，你可以咧就即係譬如寫入嚟咧，就牙醫學會裏邊嗰個咁嘅即係我哋嗰個有個 link 啦，咁大家可以咧就即係睇翻睇翻，咁然後就可以寫嗰啲 questions 入嚟啦嚇。咁如果譬如有邊個有我電話嘅，你直接嚟講咧就 message 我俾我咧，我都非常之歡迎嘅嚇。咁我夜瞓嘅，咁所以我都盡量即係可能即係希望可以解答到你哋嘅問題啦咁樣嚇。OK， 咁我想睇下 Flora 嗰度仲有冇其他問題添係啦嚇。咁有醫生問，即係話佢有間公司咧就要買一個即係嗰個 device 俾佢嗱，因為咧就未見過你嗰部機係點樣嚇，咁我哋其實咧你問到我咧，我都係其實咧就攞住個 spec 嚟睇嘅啫咁樣嚇，咁所以咧就我諗大家都可以即係呢方面，我諗我如果你有機會俾到我睇嘅，我都會幫你睇下嘅。咁但係即係呢樣嘢其實大家都可以咧，即係用你自己嗰個即係佢 knowledge 啦，或者個 judgment 咧去決定咧究竟即係譬如嗰部嘢啱唔啱你自己用啦咁樣嚇。咁啲 UV light 有一個限制咧就係，佢轉唔到彎啊！即係話咧，你如果嗰間房咧，有好多角落頭嘅話咧，咁或者有啲機擋住咗咧，咁佢未必去得到嗰啲地方。但係嚟講咧，有點都好過冇，咁即係做得幾多得幾多咯咁樣嚇。OK 啊，咁咧就嗱，呢個係我哋今日咧就即係其實琴晚更新咗嗰個即係資料嚟嘅。咁你見到有啲即係灰色嗰啲地方咧，咁其實因為就係政府啱啱改咗之後咧，咁我哋咧就寫翻上去。咁所以咧，我哋呢份咁嘅guidelines咧，我哋會 keep 住 update 嘅。咁盡可能嚟講咧，就係話除咗有而家個情況之外咧，咁我哋亦都可以咧就俾埋咧，就係如果佢轉咗啲嘢咧，我俾埋個連結。咁你大家可以咧就再 click 上去嗰個連結嗰度咧就睇一睇。咁就嗱呢個就係俾所有嘅 members 一個好 generic 嘅 information， 咁所以我亦都希望啲 members 咧，即係自己咧，即係大家啲醫生咧，都自己咧，即係因應翻自己嘅診所去制定你哋嘅策略。咁呢個就係即係譬如我哋就姑娘啦，咁但係其實嚟講，你都可以因應翻咧。如果嗰啲係你個病人，即係你會點樣做咧？即係話譬如 say，如果佢個病人確診咗之後，咁你幾耐先至肯睇佢咧？咁樣嚇，咁譬如 say 可能你即係可能要等夠佢，譬如 say 7日之後啦，咁佢兩個 RAT 都 negative 啦，你先至覺得叫做放心睇佢，或者其他 close contact 嗰啲，其實都係類似嘅方案。咁不過只係咧，每一間診所咧，你哋都有自己 custom make 嘅方案啦。咁樣 OK， 咁嗱。我咁睇下咁樣啦。如果譬如大家即係譬如再有即係再有問題嘅話咧，咁我都好歡迎大家咧，就即係一路咧都 send message 俾我哋啦，就 send 嚟牙醫學會啦咁樣嚇。咁我哋都會盡量咧就去即係解答你哋個問題啦咁樣嚇。OK，咁如果冇其他問題嘅話咧，咁我哋今晚個 section 咧，我哋就即係到此為止啦咁樣嚇。咁我哋就即係盡量咧都係大家都保持聯絡。咁大家亦都密切留意住咧牙醫學會嘅Facebook 啦。咁同埋咧我哋嗰個咁嘅即係website 啦。咁我哋都一定咧盡量將所有嘅material 咧就盡快更新咧，可以俾大家參考嘅。OK， 多謝大家。
好多謝 Dr Siddharth 同多謝 Haston 幫我哋講咗個咁 informative 咁有用嘅 lecture 咁就喺疫情2年嚟呢個第5波咧係新冠疫情係非常之嚴峻嘅。喺呢個時間咧我哋香港每一個市民都係一個抗疫團隊嘅一份子，牙科醫生咧當然都唔例外嘅。咁其實自從疫情開始，頭先 Haston 都提過啦。開始到而家，我哋牙科醫生一直都緊守崗位，隨機應變。到目前為止，我哋喺全世界嚟講，暫時係冇一個 case 係經牙科治療而感染嘅。雖然有個咁好嘅 record， 我哋千祈唔好驕傲千祈唔好俾呢一樣嘢，我哋呢個紀錄失守咁仲有一樣嘢咧，就係我哋而家牙醫學會咧喺網上邊，頭先我開始都講過噶啦，招募緊義工。義工團隊雖然而家我哋未知道有乜嘢喺呢個疫情之下，我哋可以幫到政府手嘅，但係我哋隨時準備，我哋招募定一個團隊一個 list， 如果有需要嘅時候咧，我哋可以隨時出動噶啦。 最重要一樣嘢就係今時今日，我相信我哋要喺走出呢個疫情嘅陰霾，最重要就係靠接種疫苗。咁我相信大家都已經身體力行㗎啦，但係希望可以鼓勵你自己身邊嘅親戚朋友，如果未接種疫苗嘅話，盡快去接種疫苗，等我哋可以盡早走出呢個疫情嘅陰霾。多謝大家。